Welcome back to the party, everybody. This is Morty, and I am your host, Lutch, aka the Indian Jesus, here to resurrect the second coming of common sense. Everybody hit that like and subscribe. You know I would do it for you, and let's party. Big shout out to the replay gang. Thank you so much for coming back to watch us. Even though you missed the live party, guys, that is the best part. So make sure I hear every Monday, Wednesday, Friday, 8 p.m. Eastern, and sometimes whenever I feel like it. So hit that subscribe, ring the bell, and you will never miss an Indian Jesus live party ever again. If you'd like to support the channel, head on over to TheIndianJesus.com for your very own official merch. Valentine's Day is coming up. Get a card for your boo only at TheIndianJesus.com. Guys, we do also have a Discord server that is absolutely free to join. 24/7, we're in there hanging out, having a great time. It is a great place to meet new people and have interesting conversations. And like I said, it is absolutely free. However, if you are a member of this channel here on YouTube, you can scroll right below the video, hit that join button. There's a few different tiers here, but it starts at just $2.99 a month, gets you members-only live streams here on YouTube, all that other good stuff. But the big thing is that it opens up the full Discord server. So it is free to join, but there's more if you're a member, including the After Party channel. So as soon as we are done here on YouTube, we head over there where we don't have to worry about any censorship and dancing around words or anything like that. And you are not stuck behind your keyboard. You're actually on screen with me and everybody else. It is a good time, guys. Definitely come and join us. All right. So doing something a little different today. Not too different, a little bit different in the sense that, I've been seeing a bunch of clips and stuff about the Senate hearings between like Kash Patel, Tulsi, and RFK Jr. And, I was trying to find a good, Morty coming to join us. All right. Shout out to the co-host Morty. Of course, every donation comes with a treat for Morty. And yeah, so I was looking for, the highlights of what was going on, because who wants to sit and watch a 4-hour thing where most of it's going to be boring, and then there's 2 minutes of exciting stuff, and there just wasn't. So I did what you don't have to. I sat through the whole thing and of day one of RFK's Senate hearing for the Human and Health Services. Jesus. So we are going to go through that, and I hope you guys like it, because we can definitely do more of these. So as always, guys, if you can't hear the video, please do let me know.
How could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
Well, there are many ways that we can do that. The federal funding of the SNAP program, for example, and of school lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugar drinks.
What a crazy conspiracy theorist.
So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own healthcare, of making them accountable for their own health care, so they understand the relationship between eating and getting sick. Most importantly,
there's a relationship between eating and getting sick. Nah, I don't believe it. Shout out to King Nirvana. Welcome to the party, sir. Very good to see ya. Welcome.
need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease, so that Americans understand it and make sure that Americans are aware of it. I don't want to take food away from anybody. If you like a McDonald's cheeseburger, a Diet Coke, which my boss loves,
shout out to Trump,
and you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that. But you should know what the impacts are on your family and on your health.
Right. And I mean, this is a little bit of a side quest, but exactly about how I talk about religion and saying that we need to remove it from politics specifically. I'm not trying to take religion away from anybody. I'm just trying to open up, more conservative values that you might find in Christianity to people who are not necessarily Christian. King Mom says, sounds like hippie BS. Eating affecting health? That's silly. That's some hippie dippy stuff if I ever heard it.
You should be able to do that, but you should know what the impacts are on your family and on your health.
Thank you, Senator Wyden.
Thank you very much, Mr. Chairman. Before I begin my questions,
That was a little, jump into what he was saying. I was gonna, we'll see how this plays out. Because he does like his opening monologue, but I think we all kind of understand where RFK is coming from. You know, he's essentially American political royalty until he decided to start talking about this stuff. So if anybody's not familiar with RFK and want to go see his opening remarks, we can definitely see that. But we get into the good stuff.
I'd like to start by entering into the record a letter the committee received from Ambassador Carolyn Kennedy outlining what she believes is Mr. Kennedy's lack of personal fitness for the office.
Without objection.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines.
Has he? Has he, though?
You say one thing and then you say another. In your testimony today under oath, you denied that you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No,
I'm against that vaccine. Therefore, you're a liar."
no vaccine is safe and effective. In your testimony today, in order to prove you're not anti-vax, you note that all your kids are vaccinated. But in a podcast in 2020, you said, and I quote, "You would do anything, pay anything to go back in time and not vaccinate your kids."
Based.
Mr. Kennedy, all of these things cannot be true.
Of course they can. Of course they can. What do you mean? If something is done, you can want it to not be done after it was done. What's the confusion?
So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah,
On tape. Oh, boy.
Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this, he asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective. And I was going to continue for every person. Every medicine has people who are sensitive to them.
So, meaning the full statement is actually there's no safe and effective vaccine for everyone. Not just that they can't be safe or effective, but there's not one vaccine that is perfect for everyone. Guys, if you can do me a huge favor real quick and hit that like button, it helps out so very, very much. Thank you, thank you, thank you.
Including vaccines.
Right. So
He interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden. So bringing this up right now is dishonest.
let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you
The life-saving vaccine. I don't even deny that it could potentially be life-saving depending on who's taking it. But to act like not wanting to do one thing means you're against everything in that category is just silly.
denying that? Your name is on the petition.
We brought that petition after CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for a 6-year-old.
The facts.
The rabble rousers.
The committee will be in order.
The rabble rousers.
And to the audience.
Senator, I'm not against
If you'll hold
vaccine.
off for a second, Mr. Kennedy. To the audience. Comments from the audience are inappropriate and out of order. And if there are any further disruptions, the committee will recess until the police can restore order. Please follow the rules of the committee. Mr. Kennedy, you may proceed.
I also want to point out that your recitation of what happened in Samoa is absolutely wrong, and you know it's wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine and to prevent any future access to the vaccine. Those facts are on the record. My third question to you is,
why might he want to do that? Do we care about that question or nah?
you made almost $5 million from book deals, mostly promoting junk science.
All right, what does this say? So the foreword by RFK Jr. Children's Health Defenses in the Measles book, 35 Secrets of Government and the Media Aren't Telling You About Measles and the Measles Vaccine. Provides the reader with vital, clear information they should have been told a long time ago. The readers, American and global consumers of measles vaccines, will learn that they've been misled by the pharmaceutical industry and captured government agency allies into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. I don't see an issue on the face of it, but all right, let's see what he's got.
You made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective.
Right. So are we going to ask about that? Or are we just going to take the fact that he said it and pretend that it means something that it doesn't mean?
The reality is measles are in fact deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa.
1 in 10,000, I mean, it ain't nothing, but it ain't a pandemic.
Samoa in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing to do with vaccines. I went there to introduce a medical informatics system.
Is this too fast? I can slow it down.
I would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles. Not only that,
Mr. Kennedy,
Senator, not only that.
So now that he's got an answer, like, oh, well, I'm short on time. I don't want to talk about the thing that answers the question that I just asked you. No. You know, said it's likely all info he learned it's likely all info he learned learned about some what? Try that one again.
If you let me finish.
You have had some time.
If you let me finish, Senator. If you let me finish.
Get him.
83 people died when the tissue samples were sent to New Zealand. Most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my
Chairman, I just
arrival.
would like to get my time back. The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease.
He was just articulating the nuance of that, and you cut him off to restate the original thing. If you didn't think politics was theater, I don't know what else to tell you. Leered equals lawyer. Just whatever this says, just write that again. You have all the time in the world. I promise you I will read it.
A book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
There you go. Asked and answered.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
Agreed. Agreed. They should read it. They should read it and understand it because more information is better than less information. King of Honor said it's likely all info he learned as a lawyer about some vaccines that he put into books. Just guessing. He learned. What do you mean though? It's likely all info he learned as a lawyer about some vaccines that he put into books. Meaning this guy? Just taking what he understands as a lawyer? Because, I mean, he definitely hasn't poured over the research like RFK has. That's for sure.
We need to move on. Senator Grassley.
Welcome.
All right, so we'll skip Senator Grassley, head to 46. So he tried to get his moment, but Bobby said, nah, bro, I got
Thank you.
this.
Senator Bennett.
Thank you, Mr. Chairman. Thank you, Mr. Kennedy, for being here this morning. And I think that, Mr. Chairman, we are truly through the looking glass this morning here in the U.S. Senate, and this committee is being asked to fulfill a really important responsibility, which is to decide whether to confirm Mr. Kennedy to one of the most important healthcare jobs in America. And the reason I think it's so important is for many of the reasons you said in your opening statement, which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country in the world.
But so if that's true, and it's not that we have bad medical technology, then it must be something else, right?
We live in the richest country in the world, and we have some of the lowest life expectancy rates of anybody in the industrialized world. I was a school superintendent before I was in this job, Mr. Chairman, and I can tell you that Mr. Kennedy's right, that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result.
So maybe we should put the guy in office who actually cares about that.
Of their diet. And we're, as I said, spending more than any other country in the world, and our families, every single person's constituents in this Senate are facing chronic shortages when it comes to health care. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country in mental health care, partly because of what the massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade or so. So we have no shortage of challenges to confront, and I even agree with some of the diagnosis of Mr. Kennedy. What is so disturbing to me is that
we were so close. We were so close. You're saying I agree with all of the statements that you're making and everything that's wrong with everything's wrong with the system. You're spot on. But
out of 330 million Americans, we're being asked to put somebody in this job who has spent 50 years of his life not honoring the tradition that he talked about at the beginning of this conversation.
And what is that?
But peddling in half-truths. Peddling in
so when they say half-truths, they mean not accepted by the establishment.
False statements, peddling.
When they say false statement, they mean not accepted by the establishment.
In theories that, create doubt about whether or not things that we know are safe are unsafe.
That's what science is supposed to do. Create doubt about whether the things we know or not are safe or unsafe. That is specifically and exactly what pharmacological science like that is supposed to do. Good job.
Not that every vaccine in America is unsafe, not that you can't possibly have an adverse reaction, but that parents and children in my old school district and school districts,
hold on, guys, can I get some likes up in here? God damn.
All this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children who were vaccinated, unlike the people he invited to his house in Los.
So they're gonna hit him for saying that he wishes that his kids weren't vaccinated, and then they're also gonna hit him for the fact that they are vaccinated. Come on, man. Pick a side. Pick a side.
Children who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths. And he says it with such conviction that you want to believe him.
Correct. So it's your job to show me why I shouldn't. You're not doing a very good job.
And Mr. Kennedy, I just have there are many, many things in the record, but I hope that you could answer these questions yes or no. I've tried to ask these in a manner that's faithful to what you actually said, because I didn't want to have a debate about whether you actually said them. So I'm asking you yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it?
How dare you? Wait, you went with the establishment? Oh, my bad. You're bad for another reason.
funded an NIH published study.
Did you say that it targets black and white people but spared Ashkenazi Jews?
I quoted a study, Your
Okay.
Honor. I quoted an NIH study that showed
I'll
that
take that as a
certain
yes.
races
I have
are
to move on.
disproportionately.
I have to move on.
And again, that same old trick. Well, I only have 5 minutes, so I'm going to take a long-winded way to ask you a very simple question, and then a very complex question, and frame it as a yes or no. And then when you we got to move on. We got to move on. Come on, man. And so they're implying he's doing all this for financial reasons, such as books. And as if they are not all doing, the same kind of thing. I'm sure at least half of them have their own books. People do stuff for money. It's called America, Jack.
Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
I mean, I guess I got to look more into Lyme disease. Damn.
Okay, I want all of our colleagues to hear it, Mr. Kennedy.
Then let him speak, bro. You're literally, I want everybody to hear you right now. Come on, speak up. Say it. Answer my question right. That's not, you can't do that.
That's what
You can do that, but you look like a moron.
Okay, I want all of our colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman.
Well, again, the relevant question there is that true?
Mr. Kennedy, and my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy?
I
This
believe-
matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death.
Unlike Kash Patel, unlike Tulsi Gabbard, who's
For the kids that I used to work for in the Denver public schools, and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will.
Is my thing off, or really nobody's liked the video? It's fine. Just let me know, because if my numbers are off, I'm not going to keep badgering you guys. But it's saying we got one like, and that was me to make sure that the thing was working, because there was not.
Say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We need to move on.
All right, so I guess my numbers are off. So I'll trust you guys that all of you have liked the video, because why wouldn't you? Thank you.
Senator Cassidy.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do about dual eligibles?
About,
Dual eligibles.
well, dual eligibles are,
Okay, so yeah, this gets a little boring. We're gonna go 59, 30, 59, 30. Yeah. Oh, what did you just get a clap for? Let's get that.
for elderly, that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't
You can say that again.
like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing it. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody?
Nope.
Are the premiums low enough?
We do need to move on. Senator Warner.
Well, I got to tell you, for literally hundreds of thousands
Oh, this guy. I remember this
of
guy.
Virginians. Medicaid is what prevents them from health crises on a daily and weekly basis. And some imaginary new plan. And if there was a new plan that was to be the basis of what Trump was going to do in repealing Obamacare, I would have thought by now we would have seen it. I got to tell you, listen,
Senator, can I reply to
excuse
that?
me, Senator, Mr. Kennedy, I got questions.
Then ask them.
I appreciate our visit. I know you take your views seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already.
Bro, nobody cares. If you got questions, ask the question. If you present some information to a guy who's sitting in front of, 15 of you, that implies a response. Nobody gives a shit about you. You're not who we're here for.
Seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign debt. Did your campaign, and you put out that?
I don't think my campaign exists anymore.
All right, well, listen, I got to tell you this.
Right, yeah.
Somebody's out there soliciting money for it. Maybe you ought to find out who is.
So somebody else is doing something wrong and using your name, and you need to be responsible for it.
What?
Might want something a little bit stronger than that.
Somebody's out there soliciting money for it. Maybe you ought to find out who is. So the fact that you
Campaign's been
celebrate
over
this
for
freeze,
months.
do you think that was a good idea to put all of this on hold for 90 days, funding and any kind of further work, NIH research?
As Chairman Crapo pointed
What
out,
do you, I'm not asking for, I love Mike Crapo. I'm asking you. You're up very, very important position.
as he pointed out, Senator, the
All right, let me just-
portals that were closed were not closed as a result of the Trump
Let me just tell you,
administration's
I'd like you to
purposeful
explain, excuse me,
policy.
sir. I'd like you to explain.
I thought you wanted so badly for everybody to hear. You wanted the whole dais to hear. And every time he starts speaking, you cut him off.
Let me just tell you, I'd like you to
Purposeful
explain, excuse me,
policy.
sir. I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down, where are those battered women to go? Or a rural nonprofit I've got in the Shenandoah Valley who's saying that freeze.
I mean, this is coming from me. They can go to a church, bruh. They don't need, the government is not supposed to be in charge of every aspect of people's lives.
Where are those battered women to go? Or a rural nonprofit I've got in the Shenandoah Valley who's saying that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending out, you don't know if you raised a lot of money Monday night.
I'm saying that the Trump
You
administration
don't know if
has-
you raised a lot of money.
the Trump administration has made clear that it does not want to freeze benefits
All right,
for
excuse me.
any Americans under Medicaid or Medicare, and I do not want to
There
dismantle
are, the
Medicaid.
freeze is
Either-
affecting beyond Medicare
Right?
and Social Security. I would hope you would
He's not gotten one sentence out with this Warner guy. Not one sentence.
have known that to be able to answer some of this. Now,
You should be able to answer these while I'm directly talking over you. Come on, man. 'Cause all these guys could benefit from the book. You are. Good one.
I would hope you would have known that to be able to answer some of this. Now, you've said publicly
He's like, I can if you shut the fuck up.
you want to immediately get rid of 600 NIH workers on day one. When we had our meeting, you said you actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
The ones that are wasting money. Shout out to Doge.
There's 200 political appointees that are changed during every
So
administration.
if you got rid of those 200 political appointees, you're not going to replace them with your political appointees.
Well, President Biden this year changed 3,000 employees at HHS, 3,750
So
at
your
NIH.
2,200, what departments are you going to pick them from?
Well, the same.
Well, it would stand to reason that he would need to get the job first to look at the papers to be able to determine that. I don't know exactly how this stuff works, but makes sense that he would have to get into the job first.
Your
NIH.
2,200, what departments are you going to pick them from?
Well, the same as President Biden did when he changed 3,000 out.
Let me just,
across all
I'm down to a minute,
departments.
minute 30. The chairman's been generous with colleagues on both sides.
And so you can miss it. You can miss it if you're not paying attention. That he's specifically saying, I mean, Biden just did this, and it was either not a problem or you guys were okay with it. And so now I'm just trying to do the same thing. We got to move on. Mr. Kennedy.
to go a couple minutes over, but let me just say, so let's just answer. This, I hope, since you're asking to become the top healthcare official in the United States in terms of HHS, huge ramifications, and part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past? But if you are in this position, will you pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
No, because depending on what they do and what their job is and how many of them are, we might need to axe them. We might need to get rid of some of them.
Employees who work on food safety, work on trying to preventing things like salmonella.
And so the way that he phrases it, like food safety, oh, that's important. You're going to get rid of that? No. But if you have 7 people, doing a job that only needs 2 people, get rid of 5 of those fuckers and you good.
Senator, there are 91,000 employees.
So that I take that as I take it. That's a simple yes. And I'm going to take that as a no. I take that as a no. Will you actually? We talked about protecting Americans from cyber criminals. Something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
That's how you answer that question. I commit to not firing anybody who's doing their job.
I will commit to not firing anybody who's doing their job.
Based on your opinion, based upon your opinion, or your political agenda, or Mr. Trump's political agenda?
Based upon my opinion.
Which I trust a lot more than a lot of other people.
I guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you freeze grant funding for community health centers? Will you freeze
what the fuck did you say?
Federal funds for community health centers, the way the current administration is?
The White House has made clear that no funds are going to be denied to any American for benefits.
Listen,
oh, this is the same remember, this is a week ago, but the same tired argument that Trump is freezing federal funds, and so people on SNAP benefits and EBT and all that kind of stuff, they're going to go poor. No. That's all bullshit.
And no funds are going to be denied to any American for benefits.
Listen, any program.
Yeah.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly
So you're going to excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community.
Why are you shaking, bro? Look at his hand. Look at his hand.
Good, but others are not. They're going to get their funds frozen.
I strongly
You scared? Or you just old?
support community health centers, as does the president.
So does that mean you're not going to freeze the funding that is currently frozen?
The White House has made clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates.
Even the people behind him are like, yeah, I mean, this guy's cooking.
To be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's...
All right, Kamala Harris. See, the government has money, okay? Money comes from taxes.
lots and lots of state programs that are related to healthcare that come from the federal government. They come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but...
Do you though? Because it really doesn't seem like it.
I don't feel like...
Oh, was that a laughter from the crowd?
I want to give you a fair shot, but I don't feel...
They all know. Nah, bro, you're just talking shit.
Like you approach this job with the knowledge and candidly your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer. Thank you.
So based on your opinion, you believe that you should be able to determine who works in the federal government. But your previous question made it seem like that was a very, very, very bad thing. So it's only your opinion, not an individual's opinion. Got it.
Mr. Chairman.
Senator Langford.
All right.
Chairman, thank you.
Langford. What was Langford talking about? Let's see. Langford. We just came from Warner, right? Where are we at? This is 106. So we this is let's keep it
Mr.
going.
Kennedy, it's good to see you again. We had some great visits in my office. We've done some follow-up calls to be able to go through. You and I have talked about.
So far, all of the ones that I've highlighted have been they've all been Democrats, but all people who were against RFK and really kind of just hammering him. This is going to be the first person that is a little bit more not on his side, so to speak, but is going to give him a chance to talk.
Again, we had some great visits in my office. We've done some follow-up calls to be able to go through. You and I have talked about 100 different issues and backgrounds and things. You've been able to address a lot of them today and just different questions to be able to clear up social media rumors and the things that are out there on it. So I do appreciate that. We've talked about pharmacy benefit managers. We've talked about the nursing home rule the Biden administration put down. We talked about views on agriculture and commercial and row crop agriculture. We've talked about food issues, and you made it very, very clear. You're not going to tell Americans what to eat, but you do want Americans to know what they're eating. And I think that's a pretty fair perspective on that. I do want to talk to you about some areas that you and I have talked about as well. We have some disagreements, you and I, on the issue of life and when life begins on that. You've been very outspoken on that, and we've had some good opportunities to be able to talk about that. Title 10 is specifically in the HHS area. This has been an area that has been interpreted for a long time, and President Trump in the first administration interpreted that rule to say that his administration will prohibit the performance, referral for, or promotion of abortion as a part of the Title 10 program. That he made that very clear in the first administration. Obviously, that's his decision to make again on that, on how he wants to handle that, and he's made a lot of public statements on that.
Like that the states should be able to decide and that he's not going to do it.
The Biden administration not only reversed that, not only rescinded that rule, but they went one step the other direction. In my state, in
One step in the other direction?
Oklahoma, as you and I have talked about, the Biden administration cut off funding to the state of Oklahoma for AIDS testing, for breast cancer screening, and for other areas of poverty healthcare because my state didn't promote abortion. It wouldn't provide. If my state wouldn't promote abortion in the state, we got cut off for federal funds for AIDS testing and for other things. My simple question to you is, how are you going to handle Title 10 on that? I saw how President Biden handled that in the punitive measures that came on my state for those that are in rural healthcare. How are you going to handle Title 10?
I'm going to support President Trump's policies on Title 10. I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, that he wants to protect conscience exemptions, and that he wants to end federal funding for abortions.
Oh, you mean like the American people? What they think is what our chief representative is doing.
Or abroad, that's Title 10. I serve at the pleasure of the president. I'm going to implement his policies.
Thank you for that.
Is it just me, or does RFK's voice not sound as grating as it usually does? And this is no shade, but I feel like maybe it's either something that comes and goes, or something that may not always be, as bad. It seems like he's a little bit. Maybe I'm just used to it by now. Because like the first time you hear him, you're like, "What the hell?" Maybe I'm just used to it, but I don't know. I feel like he's a little bit clear here.
I serve at the pleasure of the president. I'm going to implement his policies.
Thank you.
I mean, not clear, but better.
For that. President Biden, when he came in, immediately closed down the Office of Civil Rights and Conscience Protections within HHS. There's a statement that's come out recently that he's going to reopen that office again to be able to protect the civil rights of Americans. One of the things that Javier Becerra did immediately when he came into HHS was conscience protections for medical professionals that were being compelled against their conscience to perform medical procedures that violated their conscience. Javier Becerra stepped in immediately into HHS and withdrew that and said, no, the federal government will tell you what you believe about these issues. You don't have conscience protections anymore, and refused to protect those folks.
You want to think the right thing, don't you? You want to think the right thing. Guys, don't forget, we do have our running poll. Should RFK lead the HHS? And right now, 50% of you are saying yes, but it is split. Let me know if you said no, or I'm not sure. Let me know why.
About these issues, you don't have conscience protections anymore, and refuse to protect those folks. Will you step in and say that healthcare individuals have the right of conscience again, as the federal law allows?
Yeah, I mean, the first thing that occurs to me when you ask that question is, what patient would want somebody doing a surgery on them that believes that the surgery is against their conscience being forced to perform that? I don't know anybody who would want to have a doctor performing a surgery that the doctor is morally opposed to.
And the goal culturally should be that more doctors, not legally, not to say that the either the federal government decides or, well, it's a whole thing, but just where we are at with abortion, it should be the goal of people who are pro-life to push a cultural decision that that should be morally against what you believe. Now, there's people already in positions of pro-life, pro-choice, whatever, but there's always new doctors coming up. There's always new people, coming in and out of the industry. And the more we talk about these things, the more it can be understood that, like, we're not just trying to legislate your uterus. It's a legitimate academic, scientific argument that no, life begins at conception.
The doctor is morally opposed to. Listen, I came from a family that was split on life and choice. I have cousins today who believe that abortion at any stage is equivalent to homicide. Now, there are other people who believe the opposite. But the good thing in my family that I really loved is that we were able to have those conversations and respect each other. And I wish that we could do that nationally. And if forcing somebody to participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We need to welcome diversity in this country. We need to respect diversity, and we need to respect each other when we have different opinions. And
right, so he's not even saying that, because he's more or less pro-life, and obviously not the 9-month stuff, but he believes in choice a lot more than a lot of people in Trump's cabinet, let's say. And that is, he's not trying to legislate his decision. He's saying that we should have a variety of opinions, and everybody should be able to be heard. And if you don't want to do abortions, then you shouldn't have to do abortions. Seems pretty reasonable to me.
Not force our opinions on other people.
Yeah, thank you for that. The FDA, under the Biden administration, changed the rules for the chemical abortion drug and said you no longer need to see a physician. So if you have an ectopic pregnancy or all kinds of, don't even go anymore to see a physician. But they also changed an area that has been something that's been very particular. You've talked about a lot, and that's transparency. They changed the position and said, don't tell us if there's a side effect on this drug unless she dies. But other than that, don't tell us anymore. Literally, don't give transparent information to the American people or to the women who take this drug anymore. We don't want that reported. My question to you is, will FDA move to be able to actually give transparency to the American people and to say, this drug is no different than any other drug. We don't want to protect it just because it's political for some folks. People should know side effects on this drug, and there should be reporting.
Yeah, I mean, it's against everything we believe in this country that patients or doctors should not be reporting adverse events. We need to know what adverse events are. We need to understand the safety of every drug, mifepristone and every other drug.
And that's just basic medical science. We have to understand what medicines and what drugs and what procedures, what these things can do before we start giving them to people and doing them on people. It's not that complicated. Shout out to Quam Tech. Welcome to the party. I was hoping you'd showed up to this one. I know this is right up your alley, buddy. Quam Tech and health officials have been in charge for decades, and we've only gotten sicker. At this point, a ham sandwich had more credibility than they do. RFK for the fucking win. Hell yeah. Honestly, this is the biggest reason I wanted Trump to win. And a lot of people are in that same boat. A lot of people feel like this is the coalition of reaching across the aisle and creating this not new party, but coalition, I think is a good word, where it's not left versus right. It's the people versus the establishment. And I love it. Welcome to the party, sir. Very good to see you.
And the safety of every drug, mifepristone and every other drug. And President Trump has made it clear to me that one of the things he is not taking a position yet on mifepristone.
Thank you for the like.
A detailed position, but he's made it clear to me that he wants me to look at safety issues, and I'll ask NIH, FDA to do that.
Thank you.
I don't have the balls, not yet. I don't have the balls to be like, all right, we're stopping until I get a number of likes. One of these days, I'm gonna turn on you guys. Be like, all right, fuck it. You want the show? Like the video. Well, not yet. I'll be nice.
Senator Whitehouse.
Somebody just left. I was joking. I'm not gonna do that.
Mr. Kennedy, I only have
Like,
5 minutes with you. So, and I've got a lot of.
Look at his name. Look at his name. Mr. Hassan. Take a guess. Take a guess as to whether this guy's going to be cool or not.
5 minutes with you. So, and I've got a lot of experience with CMS. So you're just going to have to listen. That's
what I heard.
Experience with CMS. So you're just going to have to listen. Two things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations.
That's not a true statement, sir. That's what we call a lie.
Including a promise from you never to say vaccines aren't medically safe when they in fact are, and making indisputably clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in.
Whoa. You're smart. You have to listen. This is what these people do. They smuggle things into what they're saying. Listen again. See if you can catch it. I'll back it up again.
That you
listen. I think. See if you can pick out what I just picked out.
Support mandatory vaccinations against diseases where that will keep people safe.
Mandatory vaccinations against diseases where that will keep people safe. That was not the case with the COVID vaccine. So it depends on if it does actually keep people safe. Listen to it again.
Indisputably clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in that hole pretty deep. We've just had a measles case in Rhode Island, the first since 2013. And frankly, you frighten people. Two, I want to air harms that Rhode Island has experienced from a remorseless, senseless CMS bureaucracy.
What is CMS? I gotta see what is CMS. CMS Center for Medicare and Medicaid Services. All right.
A remorseless, senseless CMS bureaucracy. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers. A differential of 23 and 26% in our regional healthcare market. The Pending Ahead program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island.
So notice all this time he's been like, "This is what's up, and it's all your fault." And answer. That's what he's. That's all he's doing.
Must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act CMS took on this years ago was to make it worse. The CMS bureaucracy.
So let's put somebody else there who's gonna fix it.
Bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra Family Doctors. Tried to throw them off the shared savings program because they said Integra years ago briefly fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified.
Is there a question here, bro? This is like when somebody goes to speak at a college event and they're like, "Okay, make sure you get, when you get the mic, you go quick." You're like, "Okay, so I grew up in a middle-class family, and when I was a teenager, my mom bought a house." And like, spit it out. I'm like, said he might as well be saying, "I want you to let the government boot and be mandates even when the science has come out to prove they were wrong." Pretty much the status quo, as it were. Shout out to Box. Welcome to the party. Said, saw your timestamping this earlier. I had to make a point to stop on by. I very much appreciate that. Yeah, I got the whole thing ready to go. Appreciate it. Buck said, I know I just got here, but I feel like I need to point out that being anti-vax used to be a lefty hippie thing. Yep. Remember Jenny McCarthy and talking about exactly the same thing with autism and mRNA and all that stuff. And she was treated as crazy, by myself included, and especially by Papa Lutch, the doctor. But I have to specifically ask him about RFK. I know he likes RFK, but I haven't specifically asked him. But yeah, absolutely right. That used to be a lefty hippie thing. And then the party switched. Yep, I was right there too.
Until a court found.
I was like, bro, the science says. Oh, yeah, right. It used to be a weird thing. And that's why it was a very good rhetorical device when they started saying that, okay, it's not just anybody who is anti the notion of vaccination. It's anybody who won't take this particular shot is an anti-vaxxer. More semantic obfuscation. Taking what a word is supposed to mean, anti-vaccine, meaning against vaccines, and saying, I don't specifically think this one is appropriate for me or my family or my children or whatever. And you can just lump them in and then dunk on them. And we saw the dunks. Oh, the dunks. Shout out to my purebloods. Shout out to my purebloods. Dilly dilly to you. And yes, there still has not been a question yet.
Of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and its patients, and contrary to the public interest.
What's
that must stop. Last, CMS has refused to approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home, and Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to Granny and the family, and stupid. Granny's home dying and can't get palliative and curative care together.
What's the question?
Inhumane and stupid. Granny's home dying.
I must have timestamped this because of how egregious the grandstanding is. You're not here interested in anything that RFK has to say. This is your opportunity to be the center of attention and say the things that you want to say. This has nothing to do with America. This has nothing to do with health. This has nothing to do with children. This has nothing to do with vaccines. This has to do with, I guess this is the, what's this? Did I label this Miss Hassan? Because I guess that's the chick. Or is this White House? Either way. No. Yeah, I put, okay. So I guess this is Mr. White House. I don't know. Either way, this motherfucker is just sitting in the pocket. Hey, yo, hey, you got AIDS, bro? Like, stay that shit away from me. No, I'm just kidding. Box said, compound questions usually aren't allowed in court. This is like a math word problem. Yeah, and he's been talking since before you even got here. He's just saying, I have 2 things. This is bad. That's bad. Granny's dying. What say you? What say you? Gomtech said, Medicare insists to put her in a nursing home where family can't visit, even if she and they are vaccinated. So like I said, they don't care. They don't care about you. They don't care about your family. They don't care about health. They care about themselves and the money that they get for peddling this bullshit.
Inhumane and stupid.
I agree. You are inhumane and stupid.
Granny's home dying and can't get home care if she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies. Inhumane and stupid.
So the question is...
Granny's home dying and the family's exhausted.
How's Granny doing?
And the respite care benefit is not to send a nurse or a caregiver but to stuff Granny in an ambulance and haul her off to a hospital. Some respite. It's
Still no question. Still no question. And I remember there was, I don't remember the context specifically, but Elizabeth Warren, who is coming up, and she is going to be full Elizabeth Warren, full Pocahontas, trust me. But I remember there was something, some hearing for something or another. And it was right as I was getting into politics, and I didn't know how bad the mainstream media was. And I shared some post on Facebook about her slay it or whatever. And some dude was like, she's you realize she's just grandstanding, right? And I didn't know what that meant. And I could have been humble, I could have been meek, and I could have said, what's grandstanding? But I was too stuck on my own bullshit to be like, well, that's just what politicians do. At least she's doing it right. What? What does it even mean? What does it even mean? You're grandstanding right. Yeah, she died, right? It is what it is, man. Everybody gonna die. I can't do anything about that. Sorry.
Hospital. Some respite. It's all expensive, frightening, inhumane, and stupid. But the insensate CMS bureaucracy takes a court order to be awakened to the harm they cause. I have had enough. CMS should let Rhode Island try humane end-of-life care through CMMI.
That's where this is going. That's where this is going. This started at, where did I put him? I put him at, it's on at 125. Oh, no, I guess I didn't put him on that. But either way. Oh, no, 50, yeah, so 59. So we've been, for 15 straight minutes, he's been talking. And his goal is to say, we should be able to let the government kill Granny. So much for RIP. So much for RIP. Shout out to B. Hey, welcome to the party. Always a pleasure. Always. King says, she gonna blame him for those pox blankets? That's a bitch. He said you could literally feel their butt hurt. Yep. Because there's nothing here. The fact that it's a Kennedy, the fact that it's a Democrat person who, like, months ago was running to be the Democratic president, they don't have anything. And so you have to spin these stories about Granny's doing this. We should be able to kill her. And let me remind you, the previous question was about abortion. So not only do they want to kill people in the womb and at the beginning of their lives, they want to kill people at the end of their lives too. Why? Well, I said I was lucky. My parents didn't even I can talk and read, I promise. Buck said I was lucky. My parents didn't ever talk about politics, money, or religion ever. I was basically retarded at 20 because of it, but it was a better way of doing it, in my opinion. No indoctrination. I'm with that. I mean, I think that if you have, again, if you don't have any kind of structure in your life, I can definitely see how that could be remedied by talking about politics, by talking about religion, by talking about all these things. But you nailed it. The indoctrination. You can, if you take the time, and I mean, I'm not a parent, but I know about how the human brain works. If you take the time, it's not impossible to instill values and critical thinking skills in your children without indoctrinating them into a dogma. Shout out to Box's parents.
Humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money, serve families better at a...
Did you just say that, bro? Let's try it out. I'm sure it'll save... Let's kill a bunch of grandmas. I'm sure it'll save some money.
Humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money.
What? Haram!
Why are you... This is exactly why we need RFK.
Serve families better at a very, very delicate time, and perhaps even make a model for better health care everywhere.
A death model, today on killing yours. Well, a model.
I've said a lot. My time is out. You're welcome to respond in writing. I ask unanimous consent that the order declaring CMS's actions to constitute irreparable and illegal harm be put into the record.
So the reason that I said, oh, we should listen to this is because of how ridiculous it was. He spent his entire time grandstanding. Fox said, gray hair disqualified to speak. Hey. Is the salt and pepper okay, or the full gray is what is turning you off? Because, you know, if it's the full gray, I'm with you. But all right, where we at here? This is 118. Let's go to 125. 125.
Table section review. Senator Lang. Yes, President Trump has asked me to study the safety of mifepristone. He has not yet taken a stand on how to regulate it. Whatever he does, I will implement those policies, and I will work with this committee, make those policies make sense.
Make it make sense. That's all we want. Hey, so the biggest supporters and providers of this shit is Pfizer. They kill loads of people in Canada, and they making money. They can kill you before you're born and make money. They can chop you up while you're alive and make money. They can kill you before you're actually supposed to die and make money. It's sad. Well, like I said, if you're going to talk about politics, at least be able to see both sides, but stand on your values. Say it with your chest. Say it with your chest. Hell yeah.
Thank you, Mr. Kennedy. Senator Hassan.
Thank you, Mr. Chair and Ranking Member
This
Wyden.
is Hassan. This is Hassan. All right.
Welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, and just briefly on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid.
Still no question.
And millions of chronically ill people who, until Medicaid expansion was enacted, who couldn't get health care and therefore couldn't work because they were too sick, got health care through Medicaid expansion, then went back to work, and now they're on private insurance.
The funny thing is, like, they are filibustering, but the funny thing is, usually you want to filibuster in a situation where you don't want the other person to talk. But that's specifically the purpose of this hearing, is to hear what he has to say. So the filibuster aspect, the just talk until your time up aspect, is I don't know, maybe in the past that was a thing that everybody wouldn't be able to be like, bro, you didn't ask any questions. But it's yeah, right. They just as well be reading green eggs and ham, just not saying shit.
Got health care through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that, if implemented at HHS, would put American families' lives at risk.
Okay, I see the board going up. She's got visuals. She's got a chart. She's got something. Putting American families at risk.
Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced
Nobody cares
medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox.
Did you by chance ever think to ask him if he agrees with that statement, or are you just making an assumption based on other statements that he's made about other things? Box ad, how about you read the last chapter of 1984 or Animal Farm? It'll be the best filibuster ever. I mean, that might backfire, but I'm with you. I would love to hear that.
Something we should be proud of as Americans.
Agreed. And I think if you'd stop to ask him, do you think we should be proud as Americans for the smallpox vaccine? He'd be like, of course. Of course.
Including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research.
I wonder what they get paid. Like at that level, in a federal Senate hearing, probably making good money, right? excuse me, Behave said, I pray for a big fat guy has the biggest. They said, I pray a big fat guy has the biggest wet fart behind her. Let her cook. I wouldn't hate it. I wouldn't hate it. Mark said they get paid very well. I am not surprised. And guys, don't forget about paying me. Our swole goal is up. Not only is we got another thing ready of peanut butter for Morty, but I'll put some push-ups in there as well. Let's get swole and pay ourselves.
Extremely concerned that as secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children.
Yeah, exploit. It's exploiting. But if you talk about, you know, the danger of guns, well, that would be exploiting parents' natural worries, right? Oh no, it's only exploitation when it works against your agenda.
Exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die.
Do you have the facts for that? Because I think, again, I'm not RFK, but it seems like he would have all the information necessary to either refute or debunk that.
Before the measles vaccine, about 500 American children died a year.
And yet we still have not asked how he feels about the measles vaccine.
From measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years.
And again, it was never a 25-year spread of saying all vaccines are bad. From the very beginning, they brought up that Lex Friedman quote that was unfinished. No vaccine is without side effects or perfect for everybody. For everybody. For everybody.
For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon.
So again, no question. Just I'm going to say why you're bad and you have no opportunity to respond. So I'm going to, we're at Hassan here. Because the people that are more on his side, obviously give him more time. Where are we at? 127. Okay, so we'll get so we got some good stuff coming up. We got some good stuff. We'll let them all talk. Like I said, to be fair, no one gives a shit about the head of the HHS. Who was the HHS in 2021? Wasn't it that trans person with that had the glasses and the I feel like this is like typically you're right, but they yep. I know it, but your point remains. Like, I only know because of this. Like, I only know because of this type of meme. But yeah, other than that, well, there you go. There you go. What are you doing? You just left. You just left. Do you want to come back? Come on back. I know. We gotta wait. I can't give you food for free. What do you think this is, man? All right. Let's dive back in here.
Completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the
I'm glad that we both agree that at some point children should be murdered.
government's place to tell people what to do with their bodies.
That's
You
what
said
Trump
that,
said.
correct?
That's what Trump said.
Yep. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body. So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
So what was the first
To
one?
make that choice, right?
Yes.
Yep. But you
It's I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body.
also said we need to trust the women.
We need to trust women to make the choice because I don't trust government to make any choices.
So you said that, right?
Yes.
Yep. But you also
I don't think the government has any business.
said we need to trust the women to make.
I don't trust the government to make any choices. Sounds consistent to me. What is the issue? In both cases, he doesn't trust the government. What's the confusion? Go on seconds. Maybe it's a good thing to make something as important as the HHS heart of a common conversation. Look at how fat and unhealthy Americans are in general. I completely agree with you. Box is loving the boards. Even if, and the point is not whether or not you agree. She has two things, and she's trying to say, well, now first you said this, and now you're saying this. Nope. In both cases, he was saying government bad, people good. Look at it again.
Said that, right?
Yes.
Yep. But you
I'm pro-choice. I don't think the government has any business telling people what they can or cannot do.
also said we need to trust the women to make that choice.
Because he still does not trust the government to make those choices. What is your confusion? What are you confused about? He said Biden had the type of administration that made me fear from my no places. They looked like PDFs and aggressive perverts. Well, that's because they are.
Because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the
Clearly, you're confused. Like I said, I am also pro-choice. I don't really like it, but I am. The last person I would trust to deal with it is the government. And that's why, if you really nail me down to it, I am actually pro-choice in that sense, even though I do believe that it is murder. I think that there is, it's a nuanced enough thing that the only way to address this is to accept a certain level of murder. That's how serious this is. Buck said, fuck women's rights. What about men's rights? Men have no reproductive rights. None. Yep. Facts, sir.
past
Facts.
that bodily autonomy is one of your core values.
Uh-huh. Nothing's changed between the first and second statements about that.
The question is, do you stand for that value or not?
He made two statements standing for that value.
When was it that you decided to sell out the values you've had your whole life
Never. As you just showed, he had the same position.
in order to be given power by President Trump?
Again, he didn't. He said, I'm pro-life. I want to adopt all the babies. People are people. I'm not into murder. And I feel that. I think there's just enough circumstances where I don't want to give the government that control. I would want there to be a maybe a campaign of some sort that really educates and not shames women who are pro-choice. Because I personally feel that there should be shame associated with that. But they, meaning the pro-choice women who are willing to get these procedures, need to understand why there should be shame associated with it before the shame has any effect. You know what I mean? If they don't see anything wrong with it, then you say, "How dare you do a thing that's not bad?" It's like, what? Huh? Like I said, that's 100% it. Abortion is a murder. It's also none of my business. Both things are true. See, that's where I disagree, that it absolutely is your business. In the same way that murder is your business. You don't want to live in a society where murder is allowed. The nuances of abortion are such that it does create a discussion and an area where it's not as clear-cut as murder is bad, but it is murder. Also, there are safe haven baby drop boxes in every state. You can take to the police or fire department, no strings attached. Nah, I'll just kill it. Yep, I wanted you to sit with that.
Had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right. So, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you
It is, though.
decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that
Then why the fuck did you talk so long? His time is not limited. Your time is limited. So maybe you should spend that limited time on the guy who has all the time in the world.
regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it. You said just now the discussion about mifepristone. Oh, he's asked me to study the safety of it.
Yeah, he's the boss. Do you not do things that your boss tell you to do? Well, you're up high in a federal office, so that makes sense.
Here are the safety studies that tell us mifepristone is safe and effective. And I asked Mr. Chair that these 40...
Put a one in the chat if you think she's read one fucking page of what's in her hand. If you think she's read one fucking page of what's in her hand. Well, somebody told me that this is right, so therefore it is. I'm sure that there's no discussion that could be had where if you actually go through the papers that are in your hand right at this moment, that we could have a very deep and nuanced and educational discussion about bodily autonomy. But you have no idea what's in there. It's the science. So that's it. That's it. The science says
about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us...
Are you sure? Are you sure you're sure? You sure you're sure you're sure you're sure?
Is if President Trump orders you to take action to make it harder for women to get direly needed health care, you'll follow.
Again, loaded question. Define direly needed health care. Because an abortion is not that, unless it is the one that we've already said, yes, if the life of the mother is in danger, then do what you got to do. Exactly, Buck. Science is a verb, not a noun. Never forget, science is a verb, not a noun.
To make it harder for women to get direly needed health care, you'll follow his order. If Mr. Trump...
If you're defining direly needed as, I kind of want it, then yes.
As he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country.
So again, no. Not only has that already been debunked by the time you said this, it's already been debunked in front of your face in this hearing.
You're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that.
Which values? Being for bodily autonomy and not trusting government with those choices? What? King said, I don't trust. There wasn't a bunch of blank pages in that. Maybe. I mean, she did submit it to be an actual thing, but you never know. And Boggs is absolutely right. Getting ripped off with Medicaid. That's why everybody's saying they like Medicare, because...
To sacrifice your values, your knowledge, if President Trump tells you to do that.
Lie.
That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued a statement saying that that policy will not deprive any American.
Yeah, the problem is the White House issued that.
Well, I think he was saying something. I think no American would be directly impacted by that. No?
Policy will not deprive any American.
Yeah,
whoa. We can't have you saying that now. We cannot have you saying that now. The gentleman is so heard.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that
What was that? That sounded like projection.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know. So
the White House politicized it. Okay, I mean that was Biden, but do what you got to do. So I can't help but look at him and think of the dead bear in Central Park and where his brain worm pooped. And still, the best person to lead the HHS.
You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Thank God.
Thank you. Senator Cortez Masto is next.
Thank you. Mr. Kennedy, thank you for coming into my office and having the conversation that we did. I appreciate your passion and your belief, and you've spent years really talking about the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs.
All right, so this chick is going to go into some more abortion stuff, and then we got people on RFK's side that will actually let him speak.
Accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned.
Would that not be considered specifically an ectopic pregnancy? Isn't that the specific carve out for what abortion is not?
You would agree also as an attorney that federal law protects her right to that emergency care, correct?
Yep.
I don't know. I mean, the answer to that is I don't know. If the state
Does it?
bans
Well, let me ask you this as an attorney. Doesn't federal law preempt state law?
The federal constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. I'm
Well, I
not
would
trying to
tell
be
you in this
evasive,
case, let me ask you
Senator. I'm
this.
just telling you I don't know the
I
answer to
appreciate that.
question.
But what authority do you have over this as the director of HHS?
What authority do I have?
Yeah, to enforce the law.
I've read this 17 times. I don't know what you mean. You know, John, again.
In what regards?
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that
Well, let me tell you,
we
you
have a
do.
law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired
I don't know.
by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken.
Oh, you mean like you people would? Like, we just want to save lives. We just want people to live, and we want people to be okay. Your side is the one that politicizes all this. Right?
Let me ask you another question. When we met in my office,
Well, all right, I'm going to skip this bitch because she's not saying anything. Where are we? We're at 134, so I'm looking at 139. Talking about cutting programs. 139.30.
Average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
Senator Barrasso.
And while we're here, let's get that projection. Good call, sir. Good call. Projection.
So much, Mr. Chairman. Mr. Kennedy, thank you for taking
All right,
time
we got
to
a
visit with
friendly.
me
We got a
in my office
friendly.
prior to today's hearing to talk about a lot of the important issues affecting healthcare in my home state of Wyoming as well as the nation. I appreciate your willingness to serve our country. During our meeting, we discussed the challenges that healthcare providers and patients are facing in rural America, financial obstacles facing rural hospitals, workforce shortages, issues of OBGYN, and then new regulations that are painful that have come out of the Biden administration are hurting our ability to provide nursing home staffing.
And so again, so far, 90, I think all but one of the people that we've heard from has been trying to just make RFK look bad without even letting him talk. So this is going to be a little bit more of an opportunity to say something.
So let me start, if I could, with rural hospitals and the closures of hospitals like that. There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming. 26 are really located in areas, locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals, both Republican and Democrat states, either way, bipartisan.
So you're telling me this problem already exists? Okay.
Critical that the workforce challenges financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, yes, Senator. And I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were two. One was PBM reform, and the other is rural hospitals.
PBM reform. What's PBM reform? PBM reform. Drug topics. All right, what do we got here? Pharmacy benefit manager. Okay, there we go. PBM.
There were two. One was PBM reform.
Oh yeah, but I said, does anyone know how much it costs to fix a broken arm? Well, that depends on if you have insurance. That depends on which insurance you have. That depends on what part of the country you're in. That depends on many different things. Same question, different question, same answer. And that's a big reason why we want somebody like this to simplify the entire system so that we can understand what's going on here. Where is the money being spent? Where do we need more money? What's going on? Because right now it's just an industry, and it's not a matter of helping people. And it's sad that we have to go through this and act like that's not the case. Like, we could say, okay, maybe you're not the best person for this because of X, Y, and Z, but to act like there's not a problem that he has spent his entire adult life working to find a solution is ridiculous. I mean, it just shows exactly how much they don't care about anything but their money and their position. Because if they cared even a little bit, this would be the hit to take. Like, all right, well, I mean, I don't really love this guy. He could be a little weird sometimes, but when it comes to health, this is the guy. That should be the attitude. But, of course, it is not. Like I said, I showed up to the doctor with shingles one day with no insurance. Story in itself. It opened up my eyes. I believe you. I believe you, brother. I hear it. Guys, if we could give me two more likes, just two more likes, that would make me a very, very happy boy. Thank you.
The issue among both Democrats and Republicans, there were two. One was PBM reform, and the other is rural hospitals. And our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving.
Fortunately, you can't. I'm calling on those who have not hit the like button at all. I know you can do it, and it's free. Why wouldn't you do it for free?
And rural hospitals are
closing
at an extraordinary rate right now. They not
Thank you, sir.
only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end the hemorrhage of rural hospitals, and he's asked me to do that through use of AI, through telemedicine, which these are innovations that I saw the other day at Cleveland Clinic.
Pocahontas is up next. I need 10 likes if we're going to see Pocahontas. That's it.
Develop an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those the remote parts of Wyoming, Montana, Alaska, etc. We also have opportunities at HRSA and at the GME to finally live up to GME's mission of providing personnel to rural hospitals. And
shout out to Smarter Child. If you know, you know.
Of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that is given by both Democrats and Republicans on this committee. I intend to make that a priority if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals and maternity services. And now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Sounds like he wants to like help. And even people who aren't going to pay him. Crazy. Box News said, I prefer the Library of Babel. They should redo it with AI now. I'll wait for that to come out. And yeah, we can review that.
These specific maternal health challenges in rural America.
Yes, Senator, I look forward to it.
Another issue we specifically spoke about with this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's
if you're just joining us, Pocahontas, Elizabeth Warren's coming up
a
next.
rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem that it was a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned. But as you've said, and I've heard from many rural senators, it will be a disaster for their states.
Yep.
Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas all across our country, which means the parents, the elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high quality nursing home care is the involvement, the proximity of family members. When you move that.
I did not know that. That's I mean, that makes a lot of sense, but I did not know that. Shout out to Boyd Stanley. Welcome to the party. Said every Kennedy has turned against Bobby. He's a 20-year heroin addict and a conspiracy theorist that has no medical experience at all. That's why we like him. Because the people in the industry who have the medical experience are ponying up with Big Pharma. Remember that thing that the left used to hate until they were told that, somebody else on the right doesn't like it, so they must hate it now. I mean, if you can give me a reason why somebody needs to be a doctor to be able to understand how to read, like, I'm not being facetious here. I don't know if you've ever looked at a scientific study, but it's in English and it's broken down pretty simply. So you don't need to be a doctor to be able to read. You also don't need to be a doctor to understand how numbers work. So if X happens and that increases Y, that's it. No degree necessary. But welcome to the party. Good to see you. Hey, a shout out to Box News. Been a member for a whole month. Says she can no longer lean on her native heritage. Oh, but she will. And I know this isn't a donation, but Morty's getting hungry, so we'll give him a treat anyway. Thank you for being a member. Very much appreciated. All right, back in here.
Nursing, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was...
Did a doctor say that? Or can we just understand that makes a lot of sense? Well, it said Kennedy will kill millions of children and won't even bother him of the lives lost. Okay, maybe you know a lot more than I do. So what brings you to this conclusion? Because if that's the case, I certainly don't want to be sitting up here saying, great job. So what am I missing here that leads you to this? Because I haven't heard anything like that. And I mean, again, not being facetious, if you can educate me, I don't want to sit up here looking stupid. Shout out to M169. Welcome to the party. Said RFK Jr. is a threat to the status quo. That's why they attacked. Don't forget, the Kennedys are Democratic royalty. They have a lot of vested interest in what the Democratic Party does. All the more reason. I don't understand why that isn't a reason to be like, oh, well, he must really care because he's fucking his whole shit up. His whole family's turned against him. And random people on the internet are saying that he's going to murder babies. Would make me believe that if he didn't actually believe this, that this is not the grift to take. It's the same thing with Trump when people say like, oh, he's just lying about this, that. And again, I was never a Trumper. I did that back in 2015. But eventually you have to come to terms with the fact that if that were the case, then he would just go away. Why is he sitting here? Boyd, this is directly to you. Why is he sitting here? If he has all that with the Kennedys and he has no need to be, he's rich. He's rich as fuck. He could go live on whatever island and we would never even know who he was. He could do whatever he wants, but he's deciding to sit here in front of the Senate as they unjustly bash him. Why would somebody do that? Doesn't make sense to me. M169 seems to agree. Well, said, cool. And while all of the experts were heading this shit, we ended up becoming the most sickly nation of the Western world. I'll take my chances on Kennedy because shit sure hasn't gotten better. Yep. Monk said, because Trump is cool like that. Give him the chance. I did. And I am loving it. I'm loving it.
The kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Johnson. I think I got him on here, right? Johnson. No. All right. So Johnson was there. Let me just see. Yeah, we don't need all that. So let's skip to Pocahontas. Where's she at? 152. Sure. 152.30. Let's just start a little here.
I've been working on for my whole career.
Before that, Behave said Kennedy doesn't have a special interest paying him off to say what he's saying. So we shouldn't believe him, right? Because he has no backing from the industry. And you see, you can see exactly the capture, the mentality that, oh, the people in charge, the people at the top, they're the ones. They know. They said Bobby Kennedy is bad. Therefore, Bobby Kennedy is bad. If I was going to be out here saying stuff like he will kill millions of children and it won't even bother him, I would want to have something to back that up. Maybe Boyd is typing up a storm. Let's give him a chance. Just like I gave Trump the chance, let's give Boyd the chance. Boyd, I believe in you. I believe that you're not just saying bullshit. I believe that even if you have the wrong opinion, you have a reason to have that opinion. I believe in you, brother. Let me hear it. Gonzag said, when people finally stop being willingly blind to being fucked over, you can't stop a revolution, whether it's right or wrong. Very good point. Very good point. Do we have an example of a wrong revolution that really got there? I mean, I'm sure there is. I just can't think of anything off the top of my head. Fox News said those that can do, those that can't teach, and those that can do neither, I end up in government. Unfortunately, very true. But as we've seen, many books, many studies, many businesses from many of the people in this area. And that is why MAGA is so different, because this is the status quo. This is the status quo. And now we switching it up. The commies in Russia, but so you're talking about moral right or wrong. Okay, I'm with you. I thought you were saying, I don't know what I was thinking, but you're right. All right, moving on.
Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided.
In Soviet Russia, commies I'm usually so good with those. In Soviet Russia, food eats you. Now you're right on. You're spot on. I misunderstood what exactly what you were saying, but you're right. You're right. And 169 said someone is believing the fear mongering over childhood infections. The death rates had dropped to near zero before the shots were introduced, and Bobby helped expose that. Boyd, I'm losing faith. Boyd, oh, Boyd. I'm losing faith, brother. But I will hold that faith. See? Atheists can have faith. Or depending on what we're talking about. I might be an agnostic, according to the way that Alex O'Connor has said it. But I can have faith. I have faith that Boyd didn't just say some dumb shit and run away. I have faith that Boyd is here looking to learn and is going to present his argument. And maybe even can change our minds, because that's what we do here. We want new information to understand reality. And if somebody can come in and give that to me, well, you've changed my mind. In Soviet Russia, Jesus watches you. There you go. See, I only know this strictly from Family Guy. And I think it was like a first or second season, they had like a recurring joke. And I had that season on DVD. And so when I was on AIM after high school, I would put, I wasn't smart enough to figure out that you could do, two windows on the same thing. So I just listened to the audio of season 1, or the like disc 3 of season 1 of Family Guy while I was on AIM. You're like, hey, what's up? Nothing. You? Nothing. Just hanging out. Cool. Okay, bye. Oh.
Beta.
Bad times. Good times, bad times. I don't know.
Lampooned, derided, discredited, marginalized, vilified.
We need to move on. Senator Warren.
Here we go. Pocahontas in the building.
Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on, and that is that Big Pharma has too much power in Washington.
Come on, guys. Let's get Morty a little something. Come on, a little something.
You said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will.
Ugh, it's just ugh. The same as before. The guy who literally didn't ask a question. That vibe of this is her. Two sides of the same coin.
Corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an.
Me too. I don't know if you were here, but I was saying back in the day, there was something that I don't remember exactly what it was, but there was something that she was doing. There's a video I saw on Facebook and I shared it like, oh yeah, go stick it to the bank, some kind of thing. And somebody's like, bro, she's just grandstanding, right? I was like, instead of being, humble and being like, I don't fully understand what grandstanding actually means. I was just like, well, yeah, but she's doing a great job at it. Like, what does that even mean, bro? Why are you stop talking shit? If you don't know what somebody says, ask them.
The companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years?
Is that the standard? Is that something that you would hold yourself to? Is that something you would hold the, whatever that fat man bitch was? Are you holding them to that standard or just Bobby?
Including as a lobbyist or a board member.
Can you just repeat the last part of the question? Can I commit?
You're not going to take money from drug.
Okay, fair enough. Fair enough. But like again, the question stands: is that only for the people that we don't like that we can say you can't work in this industry? Because I'm all for stopping the revolving door of people going from politics to the lobbies and the military. I'm all for that, but not when it's selectively enforced. He said, I love you, Morty. Well, he only cares about food. I like to love. He only cares about food. Sorry. Buzz News said she is pure aside from being dumb.
Can you just Repeat the last part of the question. Can I commit
You're
to
not going
what?
to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh, yeah, I'm
You're the
happy
one-
to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this.
I don't
question.
think any of them want to give me money, by the way.
Let's
True. True. And why is that? Why wouldn't they want to give you money, Bobby? You're about to be the leader of the HHS. Seems like the perfect person that they would want to give money to. Unless you're destroying the status quo. Unless you're not here for the lobbies and the big pharma. You're here for the people. Right, Boyd? Right, Boyd? Fucking loser.
right on this.
Everybody's gonna kill something, bye.
I don't think any of them want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our number one health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've
You know what that means.
raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum.
How dare you?
You do commercials? What do you mean commercials? You can't be doing commercials and care about health. Oh my God.
Go online, you do commercials to encourage people to sign up with Wisner Baum.
No. Because was is the key word there. So what this should read is RFK was a Dem. It makes sense she liked him. Now he's not, so she doesn't. That's how it works.
You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And
Oh my God, this is awful. This is awful. Getting people justice when they're injured?
Oh, hell.
I was with him before, but that's too far.
with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million.
Based. And can't argue with that, Bucks. It's all theater. It's all theater. So you never really know. They could be fucking behind the scenes for all we know.
Who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money.
Yep. Spot on. M129 said, newsflash, no one is getting any money from the vaccine companies. They are protected. Unless what he's doing can actually break through, but I mean, yep, spot on. M129, spot.
Leave HHS. But you and I both know there's another way to make money. So, Mr.
And we all know that making money, again, is a terrible, terrible thing.
Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill.
Projection. The shill knows how to make a non-shill seem like a shill. Dilly. And that's another hallmark of this new age of instead. And look at his wife, like, oh shit, bum bum bum, but this new age where it's like you can just talk. You don't have this decorum. Yes, you want to be, you don't want to be out of order, so to speak. But this decorum where, well, Senator, I believe that what you just said was not entirely accurate when you said that I wanted millions of children to die and wouldn't care. Right, Boyd? Right, Boyd? Fucking loser.
Clarify something because you're making me sound like a shill. I put
You're the
together
one who
that
got-
case. I did the Science Day presentation to the judge on that case to get it into court, the
Mr.
Daubert
Kennedy,
hearing.
Mr. Kennedy,
Shut up. Shut up. Shut up. Shut up. You just talked for so long. And finally, you throw him a question and you talk over him. I don't understand how you think this looks. I get that you've been in this position since before like TV was even really a big thing, but like, come on. MX9 said the way it works now, vaccine injured claims are brought against the HHS. There's a tax on each childhood vaccination, and that's where the money comes from. Makes a lot of sense. A lot of CYA over here. Box said the wouldn't care part seems a bit much. Yeah, right. Like, how could you possibly? Where is that possibly coming from? And of course, it's just some fucking loser that's gonna come in. And, oh, you're bad. You're bad. They're in a cult. I was willing to sit here and have a conversation with the fruitcake. It's gonna slip out one of these days. I was gonna sit here and have a conversation with the fruitcake. Why do you think that? Okay, show me something that would lead me to believe that what you are saying is based on anything in reality. Nope.
it's just a really simple question.
Yeah,
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after.
What if they deserve to be sued?
It's just
I'll commit to not taking any fees from drug companies while I'm secretary.
It's like, no, this is my life's work. And the only reason you don't want me to take money is because you know that there's money on the table if I sue these motherfuckers. And I'm the only one. I'm the only one because as M169 is saying, it all goes through the HHS. Bot said, I have this magical power where I can turn off the volume of a screeching woman. Sometimes it happens to men too. My ears adjust. I mean, lucky you. Lucky you. If only I could turn it off. Buck said, I am pro not taking the money. I am too. I am anti establishing that the expectation is that specifically Bobby would take the money and that is a specific worry for him, as if there's not anybody else who would be up for HHS and be more likely to take that money. I think of everybody in the fucking world, he is the safest bet if you don't want big companies like that giving money to the HHS. Can you think of anybody that they would want to be partnered up with less? You can't, bro. You can't. So I agree with you. I'm pro not taking the money as well. But that's not what this line of questioning is. This is trying to establish, oh, you're probably going to take the money. Will you commit to not? Oh, you won't commit to it? That means you will.
Not taking any fees from drug companies while I'm secretary.
No. I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies.
No,
and I'm not going to agree.
That's what, yes, it is. Oh, no, you can sue them. You just can't take any money from them. What is the fucking point of suing them? If they deserve to be sued, then they deserve to be sued.
To do that.
You're asking me to not sue drug companies.
No,
and I'm not going to agree to that.
Drug
Senator.
companies as much as you want.
You just can't take any money from it.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by.
Based.
You could appoint
I
people
don't
to
understand
the
that.
CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts.
So you know what you're admitting to right now, right, Mrs. Pocahontas? That this is all already the case. This is already the case. And you're worried that he's going to disrupt the status quo. You're telling on yourself. And once you're not, and say, I want to know how much that Vax Court has paid out since its inception. I'm going to say 30 million on the low side. I'm going to say 30 million. Box News said, even if he lies, it does not matter. That's how everyone does it. There's no crime in lying here. Well, and that's all the more reason why it's like, if you could just easily lie, there's no perjury charges here. Just say what it is that they want you to that they want to hear from you. And he's still not doing it. He's still not doing it. Wait, I don't understand what other conclusion you can take from that. Bucks at 100 million. Oh my goodness. $4 billion. $4 billion. What did I say? 10 million? I knew that was going to be on the low side, but like, God damn, $4 billion. And so understanding that, the backdrop is that, yes, there's $4 billion worth of payouts from the vaccine companies. But you, sir, who is in charge of health services and dictating which of these vaccines should be taken, you can't have any bearing on if they should or if they shouldn't or any legal action. Why would you even want? Why would you even want the HHS secretary to not be able to do that? Unless you are very obviously saying, no, there's shit. We're hiding skeletons. You're not going to uncover them, right? You're not going to uncover them, right? They don't care about you. They don't care about health. They don't care about medicine. They don't care about anything except their money and their agenda. That is it. That is it. And of course, yep. Of course. What, you think that's coming out of fucking Pocahontas' pocket? Nope. That's me and you. Me and you. Over $4 billion for shit that they mandate. But yeah, no, we don't want anybody to change that, right? Mr. Kennedy, are you aware that you could do the same thing that every previous representative has, but for good? Will you commit to just not doing that? Pretty please? Just come on, man. Come on, man. Hey, I'll take the pure blood over the claim. Can I get a dilly on that? In fact, I actually want to make a poll there. Let's make that into a poll. Well, it seems like you guys are in favor of our boy Bobby here. Would you rather have pure blood, COVID, obviously, or be able to collect on, well, what's the fucking thing? Be able to collect, well, we'll just put money from it. There we go. Okay. Limited characters, you know? Boxer, the best money to spend is other people's money. I mean, true, but the government really takes that to the next level.
Special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation, even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits.
That's what we want.
You could turn over FDA data to your friends at the law firm. And
that's what we want.
They could use it however it benefited them.
Correct.
You could change vaccine labeling. You could change vaccine information rules.
Again, that is what we want.
You change which claims are compensated in the vaccine injury compensation program.
Is she trying to make a case for him?
There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS.
That's why we want him in the position. Why is it that you don't want any of those things to change? Are you saying that America is as healthy as it could possibly be? Of course not. So then what are you doing here? What are you doing? What are you doing? That's the question. What are you doing? Well, I said, stepped away for a minute. Did our boy have anything to add to his anti-RFK-isms? Not yet. Not yet. She's still yapping. She's still flapping her gums. But we are gonna. There's a bunch here. So there's some people in his on his side. So we're gonna get that, and then of course, millionaire Bernie Sanders is where we are headed. Well, like I said, the sheet of this you will get. The sheet of this you get with some drugs is like the side effects. Oh yeah, the sheet of shit. Yeah. Oh yeah. Oh yeah. Oh yeah. And that is all specifically so that people like this can hurt you and your children and your family and your mother and your niece and not have to worry about it. Exactly. Let's hear it one more time, just in case.
You labeling the lawyers no torts. You can compensation from the vaccine schedule.
No, we still got to go back.
Share your bias. Well, let me start the list. You can
Let's count. Oh, let me count the ways, Pocahontas.
Publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint people
I don't
to
understand
the CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the
dirty work. And by dirty work, you mean telling the truth. How dare you tell the truth? Guys, we are past the 2-hour mark. If you would like to keep the party raging, you know how to do it. So we're at 3, right?
CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation, even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could
7.
turn over FDA data to your friends at the law firm.
8.
And they could use it however it benefited them. You could change vaccine labeling. You could
9.
Change vaccine information rules.
10.
You could change which claims are compensated
11.
in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS. And I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits so that what you do as secretary will also benefit you financially down the line.
Why shouldn't it? Why shouldn't it? Pay the fucking man to keep our country healthy or get our country healthy. How dare he make money? How dare he make money for doing a good thing? I don't understand how you watch this and don't see exactly what I am saying. Like, you're an evil, evil, evil person that wants money and control, and he's some guy who just wants to help. Oversimplified, sure, but fight me on that. Like, come on. Well, I said if he does, will we see? And if he does, we will see it all. TV ads, anyone? I sure hope not. I sure hope not. Thank you, sir, for being a member for 2 months on 2 different channels. Thank you, sir.
Fine.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me, Senator, you're asking me not to sue vaccine pharmaceutical companies.
No, I am not. How dare you repeat the words that I just said in a slightly different manner?
You are. That's exactly what you're doing.
Look, no one should be fooled here.
We're not, sweetie. We're not. Oh, honey, sweetie, baby, we are not. I know you wish we were, but we see right through you.
That's exactly what you're doing.
Look, no one should be fooled here. As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line.
Listen to that line. Listen to the way that she said that.
That he won't interfere with those of us who want to vaccinate his kids.
He won't interfere with those of us who want to vaccinate his kids. In what world is that a bad thing? He won't interfere. Yes, his kids. She just said that. He will interfere with the great, amazing people who want to vaccinate his kids against his will.
What?
I'm with Matthew King. That's a crazy, wild thing to say. It's not hands off, lady. My kid, my decision. I don't even have kids. I can't even imagine what if you have children and you just heard this bitch fucking tell you, how dare you get in the way of people like me who want to inject your children with shit. And of course, just like Boyd, I bet that she'd be, well, you did, and you injected heroin.
How dare you?
But, inject this stuff instead.
What? Come on, man. And his promise that he won't interfere with those of us who want to vaccinate his kids. The bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it.
Okay, so if you think that's going to happen, then it should be pretty easy to remove him once he does, right? Because that's not what Americans want. So we're full of shit. Yet again. Matthew King said, I wonder if they ever look in the mirror and think, are we the baddies? No. What they do is look in the mirror. They think we're not the baddies. That is a normal Tuesday.
Kids might die, but Robert Kennedy can.
Oh, now we know where Boyd got his talking points. Where is he? Boyd? Boyd? Hey, Boyd, where'd you go, Boyd? Is it really that far up? Jesus Christ on a motorbike. Oh, I saw him. Wait. I should start this one for later. Yeah, Boyd. Now I get what you said it, Boyd. Boyd Stanley. Boyd, let's, you know what? I usually don't do this. When I'm in a mood. Let's see who Boyd Stanley is.
He loves prosperity preachers.
Said, no, we can't stop using the word fascism spelt wrong when one of the two political parties in this country is ...
And tax cuts for the rich. And my God, did he love corporations. They're a joke, but they trick.
Cool, bro. Boy, you're killing it. It was almost a year ago. 9 whole views. Number 10, baby. We are number 10. Number 10 viewer.
Going to protect us? I said, absolutely not. If we don't pay and we're attacked by Russia, will you protect us? I said, you didn't pay? You're delinquent? He said, yes. Let's say that happened. No, I would not protect you. In fact, I would encourage.
Was he snoring through that? Like, did that happen by accident? Like, what? Oh, Boyd Stanley. Jesus Christ. Not a well man. And, but, his mom's in the picture, so at least they have a good family. So, where'd we leave off? I don't know what's so hard for them to be normal, because they are not normal. They are evil. Evil. Well, so there's a real base for the Dems, but the Dems ditched them. Yep. fascism, bro. You don't get it, all right? If we're the party where we installed somebody and didn't have an election of any sort and decided unilaterally that she was going to be the leader of the free world, okay? If you guys voted for somebody, that's fascism. Yup.
Of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about this?
What a horrible, I gotta agree with Boyd here. Horrible person. A horrible person. Good science. That's a dog whistle, actually. What that actually means is that he wants to end millions of children without it even bothering him. Hey, shout out to Kwame Guam Tech. Thank you. Said, Morty, get one at least. Starving. Oh, he loves it. Thank you, sir. And of course, that makes you the new sponsor of the stream. Thank you so much. Oh my goodness. Is it that time? Are we gonna hit the goal? Oh no, did I fuck up the goal? No, why is it not counting them? Did we miss it? What the hell is going on? Oh, the time ended. All right, well, of course, he still gets his donation. Shout out to our boy Unwanted Foe. Said, how dare we want good science. So here's what we'll do, guys. If we hit $20, that's it. If we hit $20 in total, Morty gets his peanut butter. I ain't doing no fucking push-ups, but Morty will get his peanut butter. $20 from all of you. We can make it happen. Let's do it.
We'll do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as secretary?
Why? Give me one good reason why it is reasonable to say you should not make any money off of the thing that you properly do correctly. That don't make no sense. Unwanted vote. And of course, we gotta add our boy who just came through. Shout out to Carl's Frosted Tips. Thank you so very much, co-sponsors of the stream. Oh, we're loving it. Thank you so very much. Really do appreciate it. Yeah, sometimes you gotta get it rolling. I do appreciate you guys so much. Let's keep the party raging. We don't want to miss Bernie Sanders.
Science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
One of those Warren only uses 1,024th upper brain, so she doesn't add anything of value. I you know what? I disagree with that. I think she adds a lot. She adds a level of it's not the opposite of transparency. Because she's not being transparent. But we can see right through. So what's the word for when you're trying to be opaque? And we can see, is it Elizabeth Warren? Okay, I guess that's just the word. She's warning it up. She's Pocahontas singing it up. Oh my goodness. My boy said Pocahontas can eat a dick and the rest of you sponsors can too. Because I'm taking that for myself. Thank you. So very much, guys. $12 and he gets his peanut butter. $12 left, guys. Thank you so very much. You can see how much he appreciates it, and of course I do as well. Thank you. Let's keep the party raging.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations.
Wait. So he's not just some random dude? He's not just some random dude that's coming out of nowhere? And he actually has a reason to be here? And then he's giving good answers? And you're asking terrible questions? And I should be listening to you? No, I don't work like that. I don't work like that. Oh my goodness. Shout out to Ed's Funhouse. Welcome, welcome, welcome. Said liar, liar. She's a liar. Indeed she is. And hi, Morty. Oh, that one's too small. Hi, Morty. That's from Ed. Thank you, Ed. Very, very, very much appreciated. And Carl, sorry, buddy. Sorry, buddy. But we got a new sponsor of the stream. Box with the $5. So I can smell the swamp from here. And it don't smell good. It smells bad. Oh, I was going to make an Indian joke about Indians. No, Indians smelling bad, but she's an Indian. There was something there. It didn't hit it. I'm sorry. But thank you. And of course, new sponsor of the stream. Shout out to Kelly Green in the building. My favorite black rapper. Don't you know what it is? Right. Welcome to the party. Very good to see ya. We also got Kevin Johnson in the building. Coming through with the late night. All right, I guess we rolling on. Kevin said, wait, he actually proved Weed Killer was human one as well. That it was like it was that dangerous. Yeah, that was all him. Welcome. Oh my goodness. Oh my God. No way. We did it. Shout out to Unwanted Foe. I'll get this one and I'll get that one and then we'll get the goods. Said Dems busy running interference for their big pharma sponsors. Really need that NASCAR sponsor jacket idea to happen in Congress. I think that is something we could legitimately push for. I think that's something we legitimately can get, like where maybe not wearing jackets, but the publicity of wherever your money is coming from being very public. I think that's something we could do in the next 4 years at least. And of course, he said, fuck y'all, that's my sponsor spot. KFC said, eat this deck. Dems are losing their minds over Trump, and it's great. I gave him a double there. Why not? Thank you so very much. You know what that means. Look how much is on the top, too. Oh, look at it. All right, give me a high five. Good job. Give me a touch. Good job. Lay down. Good job. Touch. And a high five. Yeah, good boy. There we go. Guys, thank you so very, very much. I don't have much time left with him. And when you guys do this for me, it means the world. Thank you so very, very much. Oh my goodness. You guys warm my heart. And of course, the new sponsor of the stream. Okay, we're going to say KFT winning. Yup. Thank you so very, very much, sir. Let's see what else we missed here and dive back in. Matthew King said she only asked the question because that's exactly what her and her cronies do. They make bank off their decisions in Congress. She can't imagine others not doing it. I think that means I missed a projection. Is that what you're saying to me? That she's projecting? Agreed. Yeah, right? Oh, hey, yeah. Get me in Congress, everybody, the official seal of common sense. There we go. Shout out to the peanut butter. There we go. Yeah, there you go. Set it on right there. TheIndianJesus.com. Matthew, so can you imagine a billboard behind each congressman with different corporate logos and random people's names? I definitely could. And I think if we put that up front, I don't see a reason, or rather, I don't see a way that they could argue that that's a bad idea. What is the argument? Like, of course, they always have bullshit reasons as to why they can't do things, but, why they can't do the right thing. But what exactly could you say that is a good reason for you to hide your benefactors? I don't think you can. I don't think you can. All right, I'm back in here. Shout out to all of you. All of you. Very, very, very much appreciated. And of course, you can see Morty is loving it.
Other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he hasn't complied completely with all applicable laws and regulations governing conflicts of interest.
Mr. Chairman, point of information here. Have we had a single?
That's like when on The View, when they have their legal notes, like, oh my God, Pete Hegseth is the worst person ever. He did this. We have a legal note. Pete Hegseth did not do anything illegal.
Mr. Chairman, point of information here. Have we had a single nominee come through who's made $2.5 million?
What? How much do you make, bitch? What the fuck? What the fuck? Projection. Let's see how much she's worth. How much is, what the fuck is her name? Pocahontas. Elizabeth Warren. Elizabeth Warren Worth. Give me a no. What the fuck is this? Church top asset. Ah! For she's not what? Okay, I don't like this. It's the same page. I don't. Oh, estimated net worth of $7 million as of 2015. That was 10 years ago. So even if that's off by an order of 100,000, think about how much she's worth now. But I mean, he made $2 million. Don't get me wrong, $2 million is a lot to me. But why you acting like $2 million ain't pocket change for you and anybody else in this situation? Matthew King said, we don't want to dox our sponsors, obviously. Donations should be anonymous, of course. It's not fair if we know where their money comes from. Nah, I don't think that'll work. I mean, I think maybe under a certain dollar amount, because you're saying this would be the argument, right? So I think maybe under a certain dollar amount, maybe under $1,000, under $15,000, whatever. Like it could be a decently high number. Any donation under a certain amount number can be anonymous, but you're throwing billions. We gonna know. Hey, shout out to KFT. Ordered a shirt, head on over to TheIndianJesus.com. We got all this good stuff. There's more that won't load. I don't know why that won't load. We got cards, we got buttons, we got everything. We got everything. Head on over to TheIndianJesus.com, just like our sponsor, KFT. Thank you so very, very much. One of both said it's not fair. They are representing the states and areas they were elected. They are beholden to those people, not the corporations that sneak money through their back doors. They can fit a lot in their back doors, but that's not what it's about.
Had a single nominee come through who's made $2.5 million off suing one of the entities that it would be regulating?
No, that's why we want to start. That should be standard operating procedure.
And plans to keep getting a take of every lawsuit in the future. Have we had that before?
I haven't reviewed
No, that's why our country is so fucked.
The past documentation of every other nominee's financial interests. And so, no, but I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record, and that's why
And bitch, if you got in, then you ain't got shit to say.
he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our
you,
ethics
guys.
laws and is complied with all of those requirements. Senator Tillis.
Thank you, Mr. Chairman. Mr. Kennedy, how's your morning going?
So far, so good.
All right, we got Tellis here's on, seems to be on RFK's side, and then the millionaire, Bernie Sanders.
You came prepared. I'm glad that you did. You, I believe, addressed to my satisfaction a question about Title X and the president's priority with respect to Planned Parenthood. Can you just affirm that you are 100% behind the president's policy on Title X and the implementation?
I'm 100% behind it.
Thank you. It's amazing to me that people, well, first off, you need to understand I was in a judiciary hearing this morning. It's very clear to me that some of these nominations are going to be shirts and skins. So no matter what you answer in the affirmative, they're going to ask you one more question so that you won't be able to answer in the affirmative. That's just the way the game gets played when we
And this is just the end of my time, but I just wanted to ask, are you sure that you can't have it? No? Okay, bye.
have nominees like yourself. So I think you're handling yourself well. I got a real quick question for you. Are you a conspiracy theorist?
That is a pejorative, Senator, that's applied to me.
That was started by the CIA?
Mainly to keep me from asking difficult questions of powerful interests. I was told that I was a conspiracy theorist. That label was applied to me because I said that the COVID vaccine, didn't prevent transmission and it wouldn't prevent infection. When the government was telling people.
Whoa! That's what he's been out here saying? That the vaccine for COVID, we're talking about COVID, right? He is saying that the COVID doesn't stop transmission? Well, I've never been so wrong in my life.
Prevent transmission and it wouldn't prevent infection. When the government was telling people, Americans, that it would. I was saying that because I was looking at the monkey studies in May of 2020. I was called a conspirator. Now everybody admits.
Yeah, but you're not a doctor, right, Boyd? Right, Boyd? Right, Boyd? Right. He's not a doctor. So what are you doing looking at the science? It's the science, all right? You listen to the science. You don't fucking talk against the science. The science is what the science is.
How dare you?
I was called a conspiracy theorist because I said red dye caused cancer. And now FDA has acknowledged that and banned it. I was called a conspiracy theorist because I said fluoride lowered IQ. Last week, JAMA published a meta-review of 87 studies.
And let's take a guess. Put a 1 in the chat. Put a 1 in the chat if you think that RFK looked at a study and was right about what he said. Let's see those ones in the chat. If and only if you think that RFK looked at this fluoride study about lowering IQ and he came to the wrong conclusion.
Last week, JAMA published a meta-review of 87 studies saying that there's a direct inverse correlation between IQ loss.
All right, so I'm going to assume
I can go on for about a week.
Is there any one of them that you can say, you got me? That really was a conspiracy theory? Or are you in a position to submit for the record? I think it'd just be helpful for every one of these narratives for you to submit that maybe for the record. You said something about Snap Lunch. I was in the State House in North Carolina before I came here. And anytime I'd go visit an elementary school, the first thing I would do is go to the trash cans.
They keep coming. The ones. Everybody's like, what the heck are you talking about? Of course, as Jake would say. Does that mean that you want the vaccines to hurt people? Is that what 3 means? And another one. But yeah, so they're talking about school.
Go visit an elementary school. The first thing I would do is go to the trash cans in the cafeteria. And what we have now are kids that are not eating the food because the dictates of the federal government have made it something that they don't want. But they say, well, it's a healthy alternative. It has processed materials in it, and it's not particularly attractive to them. So they throw it away. Trash cans full of food that these kids.
slop. Straight up slop. And guys, if you are enjoying the show and or Morty enjoying his peanut butter, please do hit that subscribe button. I am live every Monday, Wednesday, Friday, 8 p.m. Eastern, and sometimes whenever I feel like it. So not only hit the subscribe, ring the bell, and you will never miss an Indian Jesus live party ever again.
Sydney. So then what do? They go eat snacks, or they go eat or they drink a sugared drink.
Oh my God. Okay. Quick side quest. I'm not even gonna full screen it. There was actually I will because Morty's eating. But there was there's a TikTok going around where this chick is like, okay, you want to see what $115 buys at a supermarket? Americans aren't fat because we're lazy. It's because of the food prices. And then she has this giant, her entire counter is just filled with snacks, name brand snacks. Ritz crackers and name brand cereal and cookies. And it's like, bitch, you're proving the point. Let's see if I can find it.
What do? They go eat snacks, or they go eat or they drink a sugared drink. The SNAP program, everything you said about the SNAP program, I agree with. I think that we should be very, very strict about that. And it's going to make some people uncomfortable in the food manufacturing segment, produce healthy foods that we can put in the SNAP program. That's the way to address it. But we also need to look at the school health program. I was PTA president 21, 22 years ago at my daughter's high school. And I feel like we've got these kids that need help. We've got to guide them through a process. Many of them are probably on Medicaid, and Medicaid's failing them. Everybody here says Medicaid is sacrosanct. Nobody's admitted that Medicaid is not producing positive health outcomes. Is that your problem with Medicaid right now? The program or the outcomes?
Is the outcomes. We're spending $900 billion. Our people are getting sicker every single year.
Yeah. So
and President Trump wants people to have it, Americans to have high quality insurance.
Anybody who's building a case for the status quo of Medicaid is by extension saying that they're happy with the outcomes. I think it's unacceptable. I do have a question for you on Project Warp Speed. We supported the CARES Act. We had 97 people in the U.S. Senate vote for it. Everybody here. There's only one member of Congress that voted against it, I believe. And Project Warp Speed had CDC, FDA, NIH, and BARDA very much in the mix. Now, some people think that you're going to come in here and insert yourself into those agencies in a way that's never been done before. Let's say that they're a part of a future Project Warp Speed. Is it your intent to go in and do something that's never been done before based on my staff's research and insert yourself in a discussion that the scientists are dealing with in those different agencies?
No, Senator. What I want to do is, I'm not a scientist. I want to empower scientists. I want to make sure that science is unobstructed by vested or economic interests.
You mean like it should be, as in being a verb and not being the noun of the science? So I didn't find the exact video, but this is it looks like same kind of thing. We'll jump back into that.
All right, guys, I am back with another grocery haul. This one is from Walmart. I am in Canada. I have a family of four, myself, my husband, and our two boys who are 12 and 6. And our budget is about $250 a week. I think I spent $257 today, so pretty close. All right, everything I got is from Walmart Canada, except I did stop and run into Loblaws quickly to get this cheese bread because we are making BLTs tomorrow. And
cheese bread. You definitely need that to be
I
healthy.
wanted them on cheese bread.
And you're definitely
all right.
Like,
well, let's get into what we got. Spencer, this is my 6-year-old. He's going to be my little helper today. Okay, you ready? What do we got first? Okay, can you go get some other stuff? Blueberries and raspberries.
Okay, this is better than the other chick.
Vegetable oil. Applesauce for lunches and creamy Caesar. White bread for lunches.
Okay, so at least she's getting like great value and stuff like that. The original one was it was just it was exactly what you think it was. It was some fat bitch saying, "Oh my God, how can we do this?" And there's cereal and candy and bullshit all over your counter. It's like, come on, man. Like, and I don't even blame her fully. Like, yes, you're an adult, and especially with children, you should know better. But you don't know better, and you believe that this is the best you can do. And that's sad. That's really sad. We'll dive back in here. Gruntek said, Snap EBT. It would be awesome if they had built-in discounts for healthy foods like eggs and grass-fed beef. I think, yeah. Yeah, I think I like that because I'm like the only thing I was thinking is then if you're getting less food based on the cost of the quality of goods and you get a discount on those things, then it should somewhat equal out to you still got to put the fucking Twinkies back because you can't afford the grass-fed beef even with your SNAP EBT discounts. But you get a discount on grass-fed beef and eggs. I like it. I like it. Matthew King said taxes ought not pay for your bag of fun drown. Yep. Shout out to who was it? Richmond, North of Richmond. There you go. There you go.
That science is unobstructed by vested or economic interest.
That's good.
I got that culture, and I'll just say about Operational Warp Speed. It was an extraordinary accomplishment, showed demonstration of leadership by President Trump.
Absolutely. Absolutely. Anybody who questions that Warp Speed was a feat of medical science is stupid. That doesn't mean that I want to inject it into my body.
When he promoted Operation Warp Speed, he was looking at all of the different remedies, including vaccines,
therapeutics, everything.
Therapeutic, ivermectin, hydroxychloroquine, famotidine, even chlorine dioxide.
Words that if you had said those words on this platform 2 years ago, your channel would be Thanos snapped out of existence.
Hydroxychloroquine, famotidine, even chlorine dioxide. And he was not looking at shutting down our country for the year, forcing people to wear masks for a year.
For 15 days to slow the spread, right? 15 days. Oh, see, just like in religion, a day doesn't actually mean a day. So a day in Democrat speak actually means 3 months.
Forcing all social distancing that did not have any scientific basis, which Dr. Fauci has now acknowledged. He said we took it out of thin air.
Mm-hmm.
But all of those changed during the Biden administration. And it became very narrowly focused. We ended up with the worst, the highest death count of any country in the world.
Mr. Chair, if I can just ask one final question, and I think it's a one-word answer. I've heard a lot of people complaining about healthcare delivery, Medicaid, on the other side of the dais here. Who's been responsible for healthcare policies over the last 4 years?
Healthcare policies over the last I think, if I'm not mistaken.
Come on, man.
The Biden.
I mean, the president, the Biden. Okay. So I'd like to have heard more of those in oversight hearings over the last 4 years. I haven't, but I'm glad that there's an acknowledgement that you're inheriting a problem that needs to be fixed.
Right. It's almost like if you address these issues at any point over the last 4 years, they wouldn't be so bad that we would need the guy that you all hate. It's like shooting yourself in the foot. Well, actually, maybe a tier system of foods, like 1/3 benefits only for junk, and two-thirds for healthy foods with better benefits based on purchasing goals. I don't take money away from the companies that make the healthy foods. They need to be supported more than anything. Yeah, and there's it's almost not dystopian, but it's not ideal that we have to legally incentivize people to take care of themselves. I think that speaks to a cultural shift that needs to happen, where we don't need to legally incentivize you not to kill yourself with food. Maybe you just don't want to kill yourself with food. Oh, but it's got vegetables. Get over it. Eat the mealworms. I got a whole bag of mealworms over here. My bearded dragon died a little while ago, and I got some extras. So, eat the bugs.
I'd like to have heard more of those in oversight.
Let's just see that one more time.
Policies over the last side of the dais here. Who's been responsible for healthcare policies over the last 4 years?
The Biden.
I mean, the president, the Biden. Okay.
Yeah.
So I'd like to have heard more of those in oversight hearings over the last 4 years. I haven't, but I'm glad that there's an acknowledgement that you're inheriting a problem that needs to be fixed. Thank you.
All right, guys. Who's ready? Who's ready? The millionaires. The millionaires. Or no, just the billionaires, because I'm a millionaire.
Thank you, Senator.
Senator Sanders.
Thank you, Mr. Chairman. Mr. Kennedy, thank you.
Ladies and gentlemen, I'm here to let you know But this man doesn't want universal health care.
For being with us. I very much like the slogan that you coined, Make America Healthy Again.
Shout out to oh, there we go. Hell yeah. Yeah, government context saying government money for healthy people that vote on the government. What? Make it make sense. Oh, Bernie. Oh, Bernie. Oh, Bernie. The champagne socialist. Dilly dilly.
Like the slogan that you coined, Make America Healthy Again. And I strongly agree with that effort.
Do you know? Seems like you agree with make America healthy as long as I get rich.
Despite spending, as you indicated, 2 or 3 times as much per capita on healthcare as other nations, we have 85 million people who are uninsured, underinsured. We have all kinds of chronic illnesses. Our life expectancy is lower than other countries. And for working class people in this country, they are living 6, 7 years shorter lives than the top 1%. We got a problem, okay? And I'm going to suggest some ideas that I think can remedy that. Last year, the
guys, you guys are amazing. He's having so much fun. I love you guys.
Insurance industry in this country made over $70 billion, while at the same time, 85 million Americans are uninsured or underinsured.
Look at Pocahontas. And she's like, oh my God, if Bernie can't do it, like, if Bernie can't do it, nobody can do it. Like, look at Bernie. Like, oh my God. He's got this. Like, people love Bernie. Seriously, if we could just get like a,
while at the same time, 85 million Americans are uninsured or underinsured. Do you agree with me that
no,
the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes?
For 40 years, this man has been singing one song until he changed the millionaires and billionaires to just the billionaires. Universal healthcare.
Healthcare to all people as a human right. Yes? No.
You're muted, bro.
Senator, I can't give you a yes or no answer to that question.
Healthcare, human right.
I can. Just like Unwanted Foe here. Nah, you do not have the right to other people's labor. Bingo.
Is healthcare a human right?
In the way that free speech is a human right, I would say it's different, because if with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taken from the pool. Well, and so are you guaranteed the same right, or is there also a duty?
I'm sorry.
Wait, whoa. You're answering the question in a way that I didn't think you were going to answer. I thought it was going to go right in my direction and that you would just agree with me. So stop talking.
Well, and so are you guaranteed the same right, or is there also a duty?
I'm sorry.
Hey, shout out to Dixie Insider. Welcome to the party, sir. Very good to see you. And as you can see, you and your friends here have helped us to get Morty his peanut butter. Welcome to the party, sir. Very good to see you. We are watching Bernie Sanders try to have a shred of dignity and integrity here, and failing like a little bitch.
Sir, you are now taken from the pool.
Well, so the question was, is healthcare a human right?
If you smoke cigarettes for 20 years and you get cancer, you are now taken from the pool. Well, and so are you guaranteed the same right, or is there also a duty?
I'm sorry.
I'm sorry. I thought you were going to agree with me.
I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. All right. You talked
correct, because it's not
about the drug companies, and maybe we agree on this one. As you all know, despite the drug companies making over $100 billion in profits, paying CEOs outrageous compensation packages, we in some cases pay 10 times more for the same drug.
This is the kind of stuff that back in 2015, when I didn't know shit about shit, that attracted me to Bernie's campaign. This is exactly the type of stuff. But I didn't realize it's just a turd wrapped in, wrapped in gold, but still a turd.
will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world?
How about we just not need the prescription drugs by fixing the food and other things that we put in our body? Makes you seem like a money grubber, doesn't it, Bernie?
Be paying a nickel more for prescription drugs than people around the rest of the world? Yes, no.
To equalize it.
Not to equalize it, that we should not be paying more than other countries for the same damn drug.
President Trump has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more.
Spot on, unwanted foe. More than people around the rest of the world. Far too focused on everyone else rather than just Americans first. America first, baby.
We showed him the charts.
He knows the charts.
Yeah, that's what happens when you show somebody a chart. They understand the chart. So thank you for your commentary, Bernie. But let's hear from the guy who we actually showed up to hear from.
A week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle we can. We should end that disparity.
Good. Okay. That's great. All right. I happen to believe that climate change is real. It's an existential threat, and it is a healthcare issue. Donald Trump thinks that it is a hoax originating in China. Question is, in your judgment, is climate change a hoax or is it real, causing devastating problems?
President Trump and I, from the beginning, from our first meeting, agreed to disagree on that issue. I believe climate change is existential. My job is to make Americans healthy again.
All right, you believe that you disagree with Trump, you don't think climate change is a hoax, is what I'm hearing.
My job here is to
I'll just ask you that, Mr. Kennedy, not a trick question.
I answer.
See, this would be a good opportunity to just give up the yes. Yes, I believe, because even if you are of the position that the climate is changing and it is caused by humans, that doesn't directly lead to we should make sure that our AC doesn't go below 78. Those two aren't the same thing. So you can if I was in Kennedy's seat right now, like, yes, I disagree. I don't think that climate change is a hoax because it doesn't fucking matter to the HHS. It doesn't fucking matter to the HHS. Whatever and which would only strengthen your position as the leader of the HHS or secretary or whatever the fuck they call it, to say, look, this is not something that's in our purview. I agree with you that there is an issue. It's just not something I can do. That would be a much stronger argument than just, nah, even if you don't believe it. Even if you don't believe it. This is a game. We all know this is a game. What to vote said Europe also pays a ton more in taxes to cover for that 10 times less in cost. It's almost like it's bullshit. But, it's Bernie, so he's like, yeah, tax the shit out of them. I ain't got to pay for it. And the king said, why do these people act like you can't go to the doctor without insurance? If you go to the hospital, they will treat you. It's not great, but they will treat you. It's not even that it's not great. It's literally the exact same. They might not be willing to do as many exploratory, tests and this and that. But if you break your leg and you go to the ER, they're not going to check your insurance first. They're going to fix your leg. And then they'll be like, all right, how are we going to deal with this? It's $40,000. Oh, I don't have insurance. Oh, okay. Now it's $3,000, which is still a lot of money. I agree. But that goes, if we take all this money that is being flooded into the drugs aspect of healthcare and shift it into the nutrition area, we will save money and people will be healthier instead of just saving money and people not being healthier. See how that works? See how that works? That was something I genuinely believed when I was a Bernie bro. And I mean, luckily, my dad was working in the ER at the time. He's like, are you stupid? Like, do you think that if an illegal immigrant comes into the ER with a broken leg, we're just going to turn them? Like, what do you think this is? What do you think this is? Who fucking told you that? Sorry, Dad. Sorry, Dad. I think I was going to say insurance really doesn't make it much better. Still on the hook for the bill half the time. Well, yeah, but they'll charge you a lot knowing that you can afford insurance and the copay. When you don't have any money, they'll take what they can get. They'll take what they can get. If you have no money, you have no money. Charging you more isn't going to help them get your not money. So they just take what they can get. It's like credit card companies. Not that I'm saying you shouldn't pay your credit card bills, but if you are in the situation where you have terrible credit card debt, the worse it is, the more of a reason there is to just keep letting it go, because they'll sell it to somebody else for pennies on the dollar, sell it to somebody else for pennies on the dollar, and eventually $100,000 turns into $1,000. I mean, it's not ideal because all of that money is again coming from indirectly from taxpayer money, but it is what it is. Dixon said 12,000 years ago, there was an ice age. The climate is always changing. We've only been tracking the history for the last 150 to 200 years. But global warming. But fossil fuels. But wind farms. Almost 9 said we have a problem paying for healthcare, not the care itself. Bar. Well said. We have a problem paying for healthcare, not the care itself. And so again, this brings us back to the many different things, but the supply and demand of that care. If we need more of that care because people aren't taking care of themselves, then it's going to be more expensive. If you just eat better and exercise. See, we missed the swole goal. Now I'm going to have to, get universal health care because you guys didn't pay enough to make me do push-ups. Joking. But the more you focus on being healthy yourself, the less strain it puts on the system. It's not complicated. It's not complicated, but they're just very, very, very good at hitting their talking points and just going. Yeah. Oh, they've only been, I knew what you meant. Yeah, they've only been tracking the temperature for the last 200 years. I said, what does the exactly? But Bernie was like, well, you agree with me that the climate is, in fact, you disagree with your boss that it's a hoax, and not only is climate change real, but it's a health concern. It's a public health concern. What? Okay, explain. That's what I would do. That's what if I'm fucking if I'm Bobby right here. I'm like, okay. I was not aware of this. Please make the connection. Well, the billionaires, they take all their money, and the billionaires, like, shut up.
Is what I'm hearing.
My job here is to
I'll just ask you that, Mr. Kennedy, not a trick question.
I answered your question, Senator Sanders.
Okay, you disagree with the president on that.
I answered your question.
Okay. I'm going to pick up on a point that Senator Hassan made. Look, there is no question that abortion is a divisive issue in this country.
Thanks to you. Okay.
I'd say a majority of the people are pro-choice. There's a strong minority who are pro-life.
I don't think so. Not according to our last election.
A year and a half ago, you went to New Hampshire, running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body. That's her.
Telling a woman what to do with her body?
How dare you?
We could never do that. What if I was climate change is racist? It affects POC more than white people. Science. Mic drop. There you go. Guam says healthy people procreate more. Bad for the planet. Okay.
You should not tell a
Show me that study. Source.
woman what she can do with her own body. That's her choice. Now,
Is it though? Well, I mean, it is, but should it though? Because oh, damn it, I'm so good. I was ready. I was ready. It shouldn't, obviously. Obviously. Because what is not her body? That's how the science works.
What she can do with her own body, that's her choice. Now, I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did.
As we've already established, not liking the government and not liking the government is not flipping on not liking the government.
Bingo.
Well, that button doesn't turn off.
Stupid. Major politician flip on that issue quite as quickly as you did when Trump asked you to become HHS secretary. Tell me why you think people should have confidence in your consistency and in your word.
Ban for the baby.
When you really made a major U-turn on an issue of that importance in such a short time.
Senator, I believe, and I've always...
It's just like, Senator, what the fuck are you talking about, bro? I've been saying the same shit, and that is why you all hate me.
A short time.
Senator, I believe, and I've always believed that every abortion is a tragedy.
But you told the people in New Hampshire that it was their right. All right, let me do a last question because I'm running out of...
So wait. Are you, Bernie? So Bernie heard that every abortion is a tragedy. And so to him, that which is a tragedy should be illegal. Now, okay, not a terrible rule of thumb. But I could think of many things, like, I don't know, taking your honeymoon in Russia. Then are not so great. But I don't know if I would make it illegal.
Out of time. I'm sure that it was their right. All right, let me do a last question because I'm running out of time. I think the gist of what you were trying to say today is you're really pro-vaccine, you want to ask questions. You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unfaxed, Unafraid.
Based.
Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No Problem.
No Vax, no problem. Get them now at RFK.com. What is it? Children something? Can we get an actual, like, come on, bro. If you're going to show the merch.
These are little things, clothing for babies. One of them is titled Unfaxed,
He's
Unafraid.
not even going to tell them where to get them?
Next one, and they're sold for $26 a piece, by the way.
I don't even have kids.
Next
I'll
one
fucking buy
is
one of these.
No Vax, No Problem. Now, you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents for $26, which casts fundamental doubt on the usefulness of vaccines.
It's almost like you spent 3 years pushing a fake vaccine that wasn't actually a vaccine and lumped people who weren't about that vaccine into another group with people who actually didn't like vaccines. No. Run it back. Run the tape back and tell me I'm wrong.
Which casts fundamental doubt on the usefulness of vaccines. Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over.
Guys, if you are having a good time, make sure you click that link at the top of the chat. That is the free Discord server. Come on over and have a bunch of interesting conversations with us. Meet awesome people. And if you want to join this channel as a member, it opens up the full thing, including the after party where we're headed as soon as this stream is done. We've been watching Severance, new episodes. We're about to watch Hillbilly Elegy at some point, and Invincible's coming back, and we are definitely watching that too. Come and join us. It is free. It is free to join.
You're going to have your organization take these products off the market.
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
Yeah, that was just a few months ago. You found
that ain't me, bro. That ain't me.
You certainly have power. You can make that. Are you supportive of this?
I've had nothing to do with
Are you
leadership.
supportive of these onesies?
I'd be like, you're goddamn right I am. No, probably not.
Supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I will I
would have said, if you're gonna go in, yeah, right. Are you for this or not? I'm like, well, I'm for the accepted science.
Anti-vaccine.
I am supportive of vaccines. I will. I want good science, and I want to protect.
But you will not tell the organization you founded not to continue selling that product.
Why would he? Why I'd be like, okay, whoa, Mr. Sanders, Congress, Senate, whatever the fuck, I don't know. Maybe you know more about this than I do. Can you cite something that would lead me to believe that what I have on these onesies doesn't align with everything that I've ever said publicly? Wait for the crickets. What's I said? Watching Megyn Kelly laughing her ass off. Was she there? I haven't seen her. I see his wife here that I can't see and not think of Curb Your Enthusiasm.
The organization you founded not to continue selling that product. Thank you, Mr. Chairman.
Senator Blackburn.
Thank you so much, Mr. Chair.
Blackman?
Chairman, and thank.
Wait, I forgot we were. Hold on. Sanders, and then we're going to do Lujan. So we're at where? Okay, fuck that. We're gonna go to Lujan at 27:30. 2:27. We'll back it up a little bit. All right.
I will give you a second, as is our practice.
Oh, listen to this shit.
Warnock, Senator Smith, Senator Young, and Senator Welch.
And let me say again, Mr. Chairman, this is a matter of such importance. A number of my colleagues would like a second round, and I think it would be important to offer, say, a modest amount of additional time to get into this on both sides. I know I have some questions. I want my colleagues to have the opportunity to raise their concerns as well.
Well, I've said, as I've indicated to you, Senator Wyden, I'm not going to do a second round. I have been very generous with the senators. I think almost every single senator has had 7 minutes at least. And I will give you a second, as is our practice between the two of us.
I'll then divide my time up with my colleagues.
Okay, you are welcome to do that.
So that's what we'll do. What do I got here? We are at 2:27. So we got one good, bad, being. All right, so we're just gonna let it ride, and then okay, I got it. Gosh, I messed that. Right. Well, hopefully, if she's sitting right there, then we'll hopefully get another one. Let's do this.
Senator Lujan.
Thank you, Mr. Chairman. Mr. Kennedy, when we met, you stated to me that it is not your goal to take away programs that work for Americans. Do you stand by that statement?
Yes, Senator.
Mr. Kennedy, do you know how many Americans rely on Medicaid?
It's about 72 million plus this.
Too many.
7 million kids are on chips.
Appreciate that, 72 million. Yes or no, is it important that expectant mothers and newborns have access to health coverage?
Sure.
Is it important that expectant mothers and newborns have access to health coverage?
Absolutely.
Everyone should have access. Should they have the ability to take other people's labor? No. But access, sure.
Absolutely, Senator.
Mr. Kennedy, do you know how many babies born in this country are covered through Medicaid?
If I did, would that make you like me more?
I would guess, I don't know the answer. I would guess about 30 million.
I have it, Mr. Kennedy. About 41% of 1.4 million babies births are financed by Medicaid, according to the National.
So they're babies. They're not fetuses. Okay.
National Center for Health Statistics. Yes or no, do you believe that Medicaid is a critical program?
I believe that Medicaid is a critical program, but that it's not working as well as it ought to be. And President Trump has asked me to make it work better, that most Americans are not happy with it. The premiums are too high, the deductibles are too high, and everybody's getting sicker. Too much money.
Everybody. What this? You're selling it. You're buying it. They force insurance companies to lower premiums. Quantum Tech, need to sell more of it. I agree. Both from your end and making your bag, and the fact that people need some goddamn life insurance. Kelly Green said fetus means baby. Bingo. Yup.
The deductibles are too high and everybody's getting sicker. Too much money is going to the insurance industry.
I have a series of yes or no questions. They're pretty simple because.
Is this an official thing? Let it be known the word child has been redefined to include unborn fetuses. Is this an official thing somewhere? Because that would be actually a pretty big cultural shift.
As you heard, we're not going to get a second round of questions. I ask for your indulgence.
Oh, no, you're not going to get a second round to talk your bullshit. Maybe you should have asked the questions the first time.
To be able to get to them, yes or no. In New Mexico, as you know, Medicaid is often measured state by state. It might surprise you if you look at some of those surveys. In New Mexico, the response was 90% of New Mexicans.
Give me a link, motherfucker. You got a wrench.
On Medicaid, report satisfaction in getting care. 80% getting specialist care. 85% getting urgent care. 95% ease of filings out of focus. Not to pick on any one of my colleagues, but in Louisiana, 86% of people on Medicaid are satisfied with their interactions. 83% are satisfied getting care.
I bet they are. The question is the people who are paying for that. I'm sure the people getting free money are satisfied. What point are you trying to make when you say, well, listen here, sir. Listen here, sir. I will have you know that 83% of people who are getting free money, free care, free stuff, they're enjoying it, okay? I don't know what's wrong with the other 17%. But all right, let's see what we got from Wanted Foe. Oh, that is not what we wanted to do. Okay, there we go. Said a child.
Child.
Plural.
Children.
A young person, especially between infancy and puberty. A person not yet of age, of majority. Well, of course, majority is going to be
majority.
A number, percentage equal. No. We're going to, what did they say? 2A? 2A. The age which full civil rights are accorded. Okay. C, a childlike or childish person. Now we're going into 2. Again, talking about child, a son or daughter of human parents. Not a trans. Descendant, also same kind of thing. Now, 3A, an unborn or recently born person. Any more we need here? How recent is that? But it's official, baby. 2 genders and a baby is in your belly when you're pregnant. Gonzek said it's a child when talking about Medicare. It's a fetus when it's an abortion. Yep. Medicaid for children and parents, at least for the first couple of years, definitely helps families, though. I'd be a hypocrite if I didn't admit it. That includes fetuses. Yeah, I don't have an issue with having help for people who need it. The problem is that we've established a culture of, okay, there's help to be had, so I'm not about that. If you legitimately need help, like we are in supposedly the best country in the world, which I believe. So I'm okay with my countrymen needing help sometimes. It's the attitude around the entitlement. That this is my money that you worked for. Is it though?
85% are satisfied getting specialized care. 82%.
I bet they are.
Getting urgent care.
I bet they are.
We want state by state, but we don't have the time today.
Hey, shout out to Right Click. Welcome to the party. Said help will be given at Hogwarts to those who need it, Harry. Good one. Welcome to the party. Dixon said also, fetus in Latin means offspring or newly born child. Well, it's a good thing that I'm not Latin.
82% getting urgent care. I can go on state by state, but we don't have the time today.
There's more people that get free stuff that are satisfied with it.
yes or no, do you support cutting Medicaid or reducing, and especially in an area where you and I spoke about with the federal investment in Medicaid?
It's a good year. It's a good year, baby.
Which is known as FMAP.
President Trump has not told me to, that he wants to cut Medicaid. He's told me to make it better.
Sorry, did you guys hear that?
In Medicaid, which is known as FMAP.
You gotta poop. Somebody gotta poop. Listen.
Investment in Medicaid, which is known as FMAP.
President Trump has not told me to, that he wants to cut Medicaid. He's told me to make it better.
Do you support?
Oh, silenced. Said make it better.
President Trump has not told me to, that he wants to cut Medicaid. He's told me to make it better.
Do you support cutting? Yes or no? Let me ask you this way, since it's only about President
Trump.
Trump.
Making it better, Senator.
If President Trump asked you to cut Medicaid, will you do it?
Oh, it's not up to me to cut Medicaid. It would be up to Congress. Oh, and
you don't
I'm going to work. I'm going to work.
Mr. Kennedy, you don't want to answer? I'll move
on. If you don't want to answer the stupid question that I asked that doesn't have a real answer, that I know that I asked, but you fucking threw it back on me and had a good answer. Oh, you're not answering the question. But he did, though. Someone not answering a question the way that you like isn't the same as dodging the question. The fellow said, cut it. The corruption and mismanagement. Absolutely.
One. Do you know how many states?
If you don't want to,
Mr. Kennedy, you don't want to answer? I'll move on.
Yeah, that was a nice move. If you had been on top of it, and you didn't have that 8-second delay, what do I do? Then I would have given you credit. I would have been like, all right, good move, because he's not giving you a yes or no answer to a yes or no question, but he did answer the question. You just weren't fast enough. One more time.
I support making it better, Senator.
If President Trump asked you to cut Medicaid, will you do it?
Oh, it's not up to me to cut Medicaid. It would be up to Congress.
One.
Oh, and
you don't
I'm going to work.
Good 3 seconds were sped up a little bit, but that amount of time, that's what they call it, a quip. Not a slope.
Mr. Kennedy, you don't want to answer? I'll move on. Do you know how
nice little chuckle there?
Many states will end? Mr. Chairman, if I may pause my time. So I understand that.
Oh, now you're going to pause your time.
People are getting asked to leave if they stand up with signs, but there's a lot of other as well, Mr. Chairman. So it needs to be extended to everyone. As Mr. Kennedy said, we should respect each other when we have a difference of opinion. We're just trying to do our jobs here and trying to ask questions. That's all. And that's all I'm doing with Mr. Kennedy, folks. So
Senator Lujan, you were right, and I asked you out.
Methinks she protests too much. Whatever.
To please be respectful.
Thank you, Mr. Chairman. I appreciate that very much. Mr. Kennedy, do you know how many
I'm gonna call your daddy
states will end their Medicaid expansion if the federal share of Medicaid drops?
Well, there's 40 states that have signed on to the expansion. So,
it's a smaller number. So it's 9 states would quickly have to end their expansion because of the laws that they have. That's about 4 million folks across the country. And in New Mexico, Iowa, and Idaho, they have triggers that it would immediately have to go into effect if, in fact, that gets cut. The reason I'm asking those questions is there's been a lot of...
I'm trying to make you look bad, even though you're a good person and will definitely make this country better.
Chatter and conversations around Medicaid. Now, I agree we can always do better, and we must be doing better in America.
That's literally what he just said. I want to make it better. So if you agree, then just say that you agree. But of course you can't. Because that would be honesty and transparency. This is politics, baby.
But Medicaid has been shown to improve health outcomes, including mortality, quality of life, and access to preventative care as well. And there's some areas, Mr. Kennedy, that you and I touched on specific to Native American.
Specifically, you mean? You don't touch on something specific. You touch on, unless you're talking about something. Let's hear that again.
There's some areas, Mr. Kennedy, that you and I touched on specific to Native American.
Okay. All right. I'll take the other
communities. One of the concerns that I have are these programs matter to folks. You shared your passion about caring for folks. I believed that passion.
And now he has said something to make you think that.
What? The question in this area is, as you know, when folks are doing research.
Folks.
And they're going to check to see if medicine works on someone. If they're not included in that trial, it often doesn't help them. That's what all the evidence shows.
Yeah, that's why medicine in general is racist and sexist, because they only test on white men.
So what are you going to do when programs are eliminated to require the inclusion of Native Americans in clinical trials when it comes to life-saving medicine?
I don't know. How about trust the science, bitch?
I'm going to do everything I can to make sure there's Native Americans in clinical trials. As I said to you when I visited your office, I spent 20% of my career working on Native issues. My family's been deeply involved with them. My family, my father and uncle.
20% of his time. Is that what he said? 20% of my career working with that is insane. Not insane in a bad way, but I mean, like, that's a lot of time for you to throw that question at a dude who spent 20% of his career specifically working on Native issues. Undervo said, cutting the corruption and mismanagement. Absolutely. Yes, please. Because that issue comes up all the time. And I mean, look, there was a time when it was a very relevant issue. I would say, I don't know off the top of my head. I mean, if I'm looking at psychology, where I have my degree, which is a very weird area of soft science, I would say that really didn't account for the differences between men and women until like 60s, 70s in there. But psychology is later to the game than everything else. So I would assume just broad medical science, at least since the 50s, has been understanding there's a difference between men and women. Have the studies reflected that? I don't know for sure. But it's not 1950. Pretty much.
My family's been deeply involved with them. My father and uncle were big critics of the Indian Health Service, the failure to deliver good health results or health care on the reservations. I'm going to bring a
guess you didn't expect that answer.
Native in for the first time in history into my central office, that all the major decisions in my office will be that we've already interviewed a candidate, a very, very good candidate, will have direct impact on all the major offices. One of my priorities is to improve.
I appreciate that. I have a follow-up in that space specifically. Will you commit to finalizing the congressionally mandated FDA guidance to increase clinical trial diversity?
Which studies are you? So, like, there are studies that don't include healthy women, just men. But the standard of a randomized medical trial, at least since, I mean, I'm just throwing numbers out of my ass here, but today, there's absolutely an understanding that this was the case, and maybe some things haven't been updated. But any new study that is done accounts for the differences between men and women.
Just repeat that again.
So, like, just to be clear on that, let's say we're talking about, the effectiveness of Tylenol, then that specifically may not have been that may not have had a groundbreaking study in the last 50 years or so. I'm not saying it is or is not. I'm just using an example. And so then you might have disparities because the testing at the time wasn't balanced. But that's not an issue anymore. Like, if you look at the science journal, it's all accounted for. And if it's not, then they use metrics within the studies that will account for that.
To increase clinical trial diversity.
Just repeat that again. I'm sorry.
Will you commit to finalizing the congressionally mandated FDA guidance to increasing clinical trial diversity?
Yes.
I appreciate that. Will you commit to reinstating all of the pages that were eliminated and people that were fired from this administration that have this responsibility?
Beta.
Fuck you. No, I'm just kidding. Thank you so much for stopping by, brother. You have a good one.
I cannot commit to that because I don't know who they are.
Well, there's
I'm committed to working with you to make sure those positions are adequately staffed.
I will follow up in writing in those specific areas because I think there's some commonality here.
All right, this guy ain't saying shit. We're gonna move to 249. Get us a little bit of what did I just say? 242.
And there's two more. No.
Obesity,
Okay.
diabetes,
All right. Okay.
heart disease account for probably 80% of health challenges in America. You know how many times I heard my friends across the aisle mention any three of those? I don't know if we've lost the forest for the trees here. Vaccine is a critical issue. I understand that. I don't see how Mr. Kennedy's position could be any more clear that he's going to support the vaccines, he's going to support the science and empowerment to parents and their doctors to make these choices. 60% of Americans have a chronic disease, that there's an epidemic of chronic diseases across the country. And this Make America Healthy Again movement is palpable to me. It started on the campaign trail in 2020 when moms I'd never met that never involved in the political process came up to me and said, look, I want to make these choices about my children with my doctor, not the federal government.
I want to make these choices with my doctor, not the federal government.
How dare you?
What an awful, awful thing that we cannot allow in America.
What?
Yeah, it sounds crazy when you put it like that, right? Shout out to Indie Film. Thank you, thank you, thank you so very, very much for the $10. Very much appreciated. Said, how about we follow science, not the. So are you that lazy? Are you that lazy? There you go. Thank you, thank you, thank you, sir. I completely agree. How about we follow science, not the science? As Bach said earlier, science is a verb, not a noun. It's a thing you do, not a thing you know.
I want to make these choices
Welcome to
about
the
my
party,
children
brother.
with my doctor, not the federal government. That it's a very real thing. Moms, dads, grandparents across the country grab me and say, look, why do 20% of our children now, why are they on a prescription drug? So, Mr. Kennedy.
Because, you know, if we make it all universal health care, then everybody can get all the drugs. Oh, wait, this is Bernie.
What is your prescription to help make America healthy again?
He's like, I'm done. So the next time, on Friday, well, I might stream tomorrow, but on Friday, what we'll do is have another swoggle that includes the rest of that peanut butter.
And what's your vision? What does that look like to you?
What is your vision? And let's go back.
Make America healthy again. Kennedy, what is your prescription to help make America healthy again? What's your vision? What does that look like to you?
Let's hear it. Let's hear it. Let's go.
Thank you, Senator Marshall. We're having epidemics of all these chronic illnesses, autoimmune diseases, neurological diseases, allergic diseseases, obesity. When my uncle was president,
people
3% of Americans were obese. Today, 74% of Americans are obese or overweight.
3 to 74.
No other country has anything like this. In Japan, the obesity rate is still 3%. And epidemics are not caused by genes. Genes may provide the vulnerability, but you need an environmental toxin. Something is poisoning the American people.
Yeah, but you're not a doctor. You're not a doctor, okay? All you want is to kill millions of children and not even let it bother you.
And we know that the primary culprits are changing food supply, the switch to highly chemical intensive processed foods. We have 10,000 ingredients in our country, in our foods. The Europeans have only 400. If you buy McDonald's French fries in our country, there's 11 ingredients, my understanding. In Europe, there's only 3. If you buy
potatoes, oil, and salt, right?
Fruit Loops in our country, they're loaded with food dyes, with yellow dye, red dye, blue dye, and many other ingredients. The same company makes the same product with different ingredients for Canada and Europe. And at age, we don't have good science on all these things. And that is deliberate. That's a deliberate choice not to study the things that are truly making us sick, that are not only contributing to chronic disease, but to mortalities from infectious disease.
Yep. Well, the diet and exercise. Stop eating shit and sitting on the couch. We're just looking for I was just looking for a TikTok that I saw where some lady was like, "Oh my God, it's so bad in America because we can't get food, and this is what $115 gets you at the grocery store." And she has her entire counter filled with bags of processed name brand bullshit.
We need to get a
and then she came back online to try to defend herself.
Handle on this, because if we don't, it's an existential threat. Our country is not going to be destroyed because we get the marginal tax rate wrong, or because we get one of these culture war issues that we've been talking about today wrong. It's going to be destroyed if we continue down this trajectory of chronic disease. We need to fix our food supply, and that's the number one.
Thank you, Mr. Kennedy. Certainly, I share your concern with ultra-processed foods. On the other end of this food chain are my farmers and ranchers back home. Would you just take a second and share your compassion, how you feel about farmers and ranchers, that they respond to the market? They don't dictate the market. They grow what the market is wanting them to grow.
Imagine if he was just like, "Fuck farmers, bruh!"
And Senator Hawley told me the other day that his brother-in-laws are all farmers. And he said 4 out of every 5 of his brother-in-laws has Parkinson's disease. And that kind of cluster we're seeing across farm country of cancers, autoimmune diseases, obesity, et cetera. Oh, it's, and we can now not export American food to Europe because the Europeans won't take our food. That's not good for farmers.
I'm good.
We're
I'm
also
good.
destroying our soil because some of the chemicals that farmers use destroy the microbiome. And that causes the erosion of the soil. You can't get water infiltration. Water pools up and it washes the soil off. Agronomists now estimate that we only have, if we continue doing these processes, only 60 harvests left before our soil is gone.
What a bad guy. What a bad guy. Boyd, oh Boyd, oh Boyd.
So farmers are using seeds and chemicals that are over the long term are costing them and us. And what we need to do is we need to support the farmers. We need the farmers as partners if we're going to make them work. And I don't want a single farmer to go out of business under our watch. I don't regulate farms. If I'm privileged to be confirmed, I'm not regulating farms. That's under USDA. But
and so as of now, he has advanced from this. But I don't think, I think there's another step for him to actually be confirmed. Don't quote me on that. Hey, shout out to Indie Film. And he just said, yeah, fuck you. I'm the sponsor now. I'm the sponsor. Oh, wait, let's go full screen. There we go. Sponsored out. Oh, he is tired out from that peanut butter. Thank you, sir. Very, very, very much appreciated. You got something less of me tonight. My goodness. So you know what that means. Let's keep riding. Thank you so much.
I'm not regulating farms. That's under USDA. But I want to partner with all of my decisions.
Sorry,
with
Carl.
USDA and with the farm community to make sure that we don't lose more farmers in this country, but that we also transition. We offer and incentivize transitions to regenerative agriculture, to no-till agriculture, and to less chemically intensive. And by the way,
okay, you had me a little scared when you said we need to transition, right? But okay.
I've also met with the chemical industry and the fertilizer and herbicide companies, and they want to do the same thing. Oh, and I think we're on the trajectory to do that, and we need to incentivize initiatives to accelerate that trajectory.
Absolutely. And exactly what Infilm is saying here. Not too long ago, Americans grew some food in their own yards, like apples, carrots, and cucumbers, and now nobody grows anything. What the hell is going on? There is there's a cultural negativity to that. There's a cultural benefit from being somebody who just goes and buys stuff. So like, shout out to Soul of the Soul. I don't know where she's been. She comes and she jumps in every once in a while. but she is definitely doing it right. She's got her garden, and when I do own this place, but I don't want to live here forever. And whenever I move, I want a little bit of land, not a lot of land where I got to like worry about fucking a whole 7 acre, maybe like an acre, half an acre, little house, small house. You guys know I already be forgetting shit down here. I live in a little fucking 1-bedroom loft. I'm like, oh goddamn. So small house is all I need. I just need my shit. I just need my kitchen, my bathroom, my bedroom, my TV room. We're good. Then outside, I want my garden. I want a shooting range for my bow. I want to be able to get some pew pews. And just live, baby. Just live. America, Jack. That's America, Jack.
Initiatives to accelerate that trajectory.
Mr. Chairman, if I could, the great news is that my farmers in Kansas are selling products to Europe. That today's regenerative practices, soil health, all those things are priorities for Kansas farmers. Many of us are doing many of those things already. We just need it to be more widespread. If I could just wrap up my remarks, though, is that, again, going back to the big picture here, 60% of Americans have a chronic disease. Mr. Kennedy, I believe for such a time as this, that you're not just one of 300 million people. I think that you are the
one, yes,
to lead HHS to make America healthy again, that God has a divine purpose for you. And I look forward to your confirmation and working with you to make America healthy again.
Did I not say exactly that? Except for the God part. Did I not say there is nobody, or maybe not there's nobody, but what I said was name somebody who would be better for this position at this time than RFK Jr. You can't, bro. You can't.
Thank you, Senator.
Thank you.
All right, we got somebody.
Senator Warner.
Somebody. I don't remember. I don't remember exactly what's about to happen, but the note that I wrote to myself was CDC equals Nazi with an angry face and a star. So I think it's about to be fun. So the soul for HHS chair. Hey, Dilly, the soil to soul. I would vote for her. I would vote for her. Somebody click that up and send it to her.
Thank you so much, Chairman Crapo and Ranking Member Wyden. It's great to be here. Mr. Kennedy, welcome. Welcome to you and to your family. Thank you for meeting with me a few days ago. I'd like to follow up, if I might, with...
Guys, really quick, I got to ask you a huge favor once again. I know there's a bunch of new people here, and I would be so heartwarmed if you could hit that subscribe button. Even if you're somebody who doesn't really subscribe, just do it for me. It's free, it's easy, and I promise, I am here to give you the best. And if you don't like it, then you can just unsubscribe. But just hit that subscribe button, and you can be like, same Willard. Welcome to the party. Very good to see you, man. Good to see you. Said people are now lazy. I mean, people have been lazy, but the degree of laziness has just begun. It has just gotten insane. But welcome to the party. We are not closing down soon because we got our boy Indie Film keeping the, where's my applause? Keeping the party raging, out sponsoring himself. Maybe I should tell him somebody else is a sponsor so he keeps going. But thank you, sir. Yes, I am definitely going for sponsorship tonight. And you got it, brother. You got it. Thank you so much. Let's keep raging on.
Meeting with me a few days ago. I'd like to follow up.
Any film. KFT bought a shirt. So get on that. That's shout out to any film for keeping that afloat. Sam said COVID showed folks that they didn't have to work hard. Among very many other bad things, I completely agree. COVID showed folks you just don't have to work hard. You just don't. And unfortunately, that is a reality. You can get by. You can be in office and not have to work hard. That needs to change. And I think it's going to.
If I might, with some of the issues that we discussed in my office, I want to talk to you first about the CDC, or the Centers for Disease Control and Prevention. I'm proud of the work that the CDC does, proud that it's located in Georgia with more than 10,000 employees in my state. If confirmed, you would be the cabinet secretary over the CDC. Representing HHS, it's about 29% of the federal budget. CDC is a part of that. Do you agree that the CDC's work is critical to Georgia, critical for our country, and the health of the entire world?
Nope.
Yes.
Senator Isaac.
Yes, in the sense that, like, if nobody was doing anything, it would be worse. But we could definitely do better.
My Republican predecessor would have agreed with that. Bless his memory. He was a fierce advocate for the CDC, as am I. The CDC is an agency filled with hard-working, dedicated public health servants.
That was
They wake
perfect
up every
timing.
single
Thank
day,
you.
Working to keep us safe. I think we don't think often enough about their work because it's easy not to celebrate folks who are protecting you from that which doesn't appear because of the work that they're doing.
Yep. And this is why Doge, it's such an amazing thing. And I definitely am not sure how to feel about the fact that Vivek chose, or is seeming to choose, running for office over Doge. But we got Doge. We got Doge. Yeah, only if they're honest. And they never are. They never are. Honesty, what's that?
Not to celebrate folks who are protecting you from that which doesn't appear because of the work that they're doing. So grateful for the work that the CDC employees do. Some of them are members of my church. I saw that deep commitment firsthand when I visited the CDC just last summer. Mr. Kennedy, you have compared the CDC's work to Nazi death camps. You've compared it to sexual abusers in the Catholic Church. You've also said that many of them belong, this is a direct quote, many of them belong in jail.
Hard to disagree with that.
For me, those are disturbing characterizations of the CDC workers that I know who are trying to keep the American public safe every single day. And
yeah, I know a police officer, right? And he every day, he leaves his house and he doesn't know if he's coming home. He just wants to help people. So therefore, police are always right and good. What? Oh, that's not how logic works? Okay. Yeah, Planned Parenthood catching strays.
As you are presented as the nominee for this position, right. I need to know, do you stand?
Right. If they actually did their job, sure. But like IndieFilm just said, 10,000 employees at the CDC. Bet they could run with 1,000. I bet that you're right. And I bet that Elon's going to slash and slash and slash. Hopefully. And so what the hell is this guy talking about? We all remember what the CDC did during COVID, right? Well, we do. But remember, they still think that the CDC has been right the entire time, and we were wrong the entire time. They still think that with all the science. That's why it was never about the truth. It was never about the science. It was about being right. It was about being right. It was about winning.
And by those statements that you made in the past, or do you retract those previous statements?
The teachers union ran what?
Senator, I don't believe that I ever compared the CDC to Nazi death camps.
But if I did, then if the shoe fits.
I support the CDC. My job is not to dismantle or harm the CDC. My job is to empower the scientists if I'm privileged to be confirmed.
So you retract those statements?
I'm not retracting it. I never said it.
Well, actually, I have a transcript
of me saying that it's a Nazi death camp.
Let me read your words.
Yes, please do.
It says that the institution.
Put a one in the chat if you think it's not going to be how he presented it. That it's going to be something slightly that if you twist it, it could be like that. But what he's about to read is not going to be a comparison between the CDC and Nazi death camps. Give me a one if you think that is the case. The teachers union ran the CDC. That makes a lot of sense. Yeah. Okay. So you're saying going to be out of context. Let's see.
I'm not retracting it. I never said it.
Well, actually, I have a transcript
of me saying that it's a Nazi death camp.
Let me read your words. It says that the institution CDC and the vaccine program, is your description of their work, is more important than the children that it's supposed to protect.
Wait, one more time.
Program your
Vaccine
description of their
program.
work, is more important than the children that it's supposed to protect.
He said the CDC is more important than the children they're supposed to protect.
And, you know, it's the same reason we had a pedophile scandal in the Catholic Church. It's because people were able to convince themselves that the institution of the church was more important than these little boys and girls who were being raped.
Uh-huh. Got it. So I hear that he's saying that children are being put in harm's way unnecessarily. I don't hear Nazi either. But let's hold our horses. Let's hear about
these little boys and girls who were being raped. That's pretty provocative language. You said,
is it happening? Oh, it is. So is it provocative language or is it provocative behavior from the church? Yeah, be mad at the guy calling out children being raped. How dare you call that? Yeah, you're raping the children. Don't worry about it. Don't call it out. What do you think this is? What do you think this is? This is the U.S. government, all right? We hide that shit. How dare you? How dare you?
Who were being raped. That's pretty provocative language. You said in another statement to me, this is like Nazi death camp. I mean, let me finish. I'm just reading your words. I mean, what happened to these kids? 1 in 31 boys in this country, their minds are being robbed from them.
True. What does that have to do with Nazis? Sam said I just got kicked out of my church. What the fuck did you do? How do you? I thought, especially these days, I thought churches were accepting of everything. Well, how do you get kicked out of church? Ed Funhouse said, "Good thing Islam doesn't rape."
Haram.
Yeah, I was not.
Oh wait. That was it. Okay. All right. We're gonna hear it in full. I'm not gonna break it up. Let's go the whole way back.
That is a Nazi death camp.
Let me read your words. It says that the institution CDC and the vaccine program, is your description of their work, is more important than the children that it's supposed to protect. And, you know, it's the same reason we had a pedophile scandal in the Catholic Church. It's because people were able to convince themselves that the institution of the church was more important than these little boys and girls who were being raped. That's pretty provocative language. You said,
I'm sorry. I really wanted to play it through. But when you hear the sentence that little boys are being raped, your issue is with the language? Make that make sense.
In another statement to me, this is like Nazi death camp. I mean, let me finish. I'm just reading your words.
I want the full thing.
Language. You said in another statement to me, this is like Nazi death camp. I mean, let me finish. I'm just reading your words. I mean, what happened to these kids? 1 in 31 boys in this country, their minds are being robbed from them.
Yeah, I was not.
Am I stupid? Am I dumb? I was listening pretty closely, and I don't think I heard anything Nazi-esque. Sam said, no, the rapes were not known. The church was given police power for itself. Well, I mean, they weren't known by the public, but they were sure as shit known by the church. Sure as shit known by the church. So yeah, that was all.
Comparing the CDC to Nazi death camps, I was comparing the injury rate to our children to other atrocities. And I wouldn't compare of course, the CDC to Nazi death camps to the extent that any statement that I made has been interpreted that way. Yeah, I don't agree with that. In 2003, the United States Congress Government Oversight Committee ended an over.
This is our government. This is our government. Keep that in your head that we now have a president. The last 4 years, we just didn't. So this is Welch. See, and the other one. So when I went through the Tulsi one, they had all the names and everything. Nope. 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 Black. That's not a black guy. RFK, Senate. Senate. Well, unless I got the name wrong. Okay, so I did get the name wrong. So okay, I don't know who this is then. Who do I have? Marshall. Yeah, I don't know. I don't know who it is. I thought it was Welsh, but I guess the guy next to him. They have the way the table is. It's like rounded. So the name that I saw, like, oh, you could see it. The name that you see when it goes in front of him. It says Mr. Welsh right in front of him. I mean, come on, man, come on. I mean, oh, come on. Look at this. It says Mr. Welsh right in front of him. So I don't know who it is.
I admit that this profits ahead of the welfare and health of American children. So that was a conclusion by Congress. And I repeated that.
I'm asking you because you're the nominee for HHS. It sounds like you stand by those statements.
Senator, my object.
Yep. Not by your characterization, but what I actually said. Yeah, I stand by what I said. Not the bullshit that you said.
Bingo.
This is the Democrats. Yep. I want to vote. So they have name plaques. Rewind a bit. It should show his name. Definitely an asshole. Shout out to Hector Estrada. Welcome, welcome, welcome to the party. I don't know what the access thing is. Please educate me. Warnock. I've heard that name. Yep. Well, wait, no? Is it? Yeah, that definitely seems like a new name. I don't know. It's some fruitcake. Not that was. That's all I was thinking. You know what I'm saying? Go ahead, RFK. Just say the shit the CDC was trying to implement on children was the same as Nazi camps. Right, but this was last week. We didn't have any elections in the last week. So if he's there, okay, let me get the name. I feel like unwanted photo is a solid Google. Anyway,
is to support the CDC. There's nothing I'm going to do that is going to harm CDC. I want to make sure that our science is gold standard science, so that it's free from that same government oversight.
We got another 50 people on X.
Investigation committee. That the panels, the ACIP panel, and within CDC, I think 97% of the people on it had conflicts. I don't believe that that's right. I think we need to end those conflicts and make sure that scientists are doing unobstructed science.
So I want to enter this statement, by the way, into the record without objection.
Without objection.
Last week, the White House gagged HHS and the CDC, preventing them from communicating all important public health information to anyone, including all of our allies, including our allies in the United States and global disease prevention. Can you just answer yes or no, because I'm running out of time? Do you agree with that action?
I was not consulted on it, but that's pretty much standard operating procedure for incoming administration.
So you agree with the action that gagged HHS and CDC from communicating important public health information?
That directive made sure that no.
All right, I'm so done with this. So let's go. We got a bad one, and then a good one, and then the lightning round at the end, and that is all we're doing. So where we at? 2:59.
Welcome, Mr. Kennedy. So, Mr. Kennedy, I
look at that timing. Look at that time.
Don't have a question for you on abortion. I think that my colleagues on both sides of the aisle have covered this, but I want to say I can respect people who have different views than mine.
I'll just say, Mr. Kennedy's position on abortion is that it is always the woman's right to choose. He does not support legislation banning abortion. The statement from Kennedy's campaign said, "Oh, just like Trump."
on this issue, but it's hard for me to respect people who won't give a straight answer to what they think on this issue in particular.
Projection. I'm going to cut you off so you can't give a straight answer, and then or ask you a completely out of pocket question that is not a yes or no question, and frame it as yes or no, and then act like you're not answering the question, so that I can shit all over you. Crazy times, indeed.
Mr. Chair, I just want to note that I understand that anti-choice advocates have said that in these hearings they were
anti-choice. That's a new one. That's a new one. Okay.
Note that I understand that anti-choice advocates have said that in these hearings they were looking to hear Mr. Kennedy provide some reassurance that he is on their side, and I'm not hearing that.
Can we steal that? Pro-abortion is now anti-choice. Like that is more accurate. You're taking the choice away from the child.
And I think most Americans are looking for some hint that the decisions that people make about abortion should be personal and private, and they should be free to make those decisions without government interference. And I'm not hearing that either. To make it worse, the answers that you have given tell me that the Trump administration is more than willing to restrict or even ban medication abortion without a single act of Congress, and even in states where abortion is legal.
Do you mean the thing that he said he wouldn't do?
And what is clear to me is that you and President Trump are dangerous to women's access to mifepristone. So having said that, I want to move to a different topic. Mr.
Then why did you bring all that up? This is, again, like, we're here to see if this guy is good for health and human services. But y'all just want to fucking talk about what y'all want to talk about. As if we don't understand what a hearing like this should be about. They think you're stupid. Most people are, but they think you are one of them. Well, United said, ACIP is a rubber stamp. All you have to do is watch one panel.
Kennedy, I appreciate Senator Cornyn's questions about mental and behavioral health, something that I care a lot about. I know that you and your family have had personal...
From the Bill Barr podcast. Okay, if you don't want the kids to be killed, then just let them do it before they turn into kids. Okay, it's not that hard. What did I say? There's no time in American history or human history that kids were going to shoot schools and going to shoot schools and their classmates. It really started happening coterminous with the introduction of these drugs with Prozac and the like.
Experience with mental health challenges?
Yep.
As have I. And I agree that the mental health crisis in this country is a crisis. So let me ask.
That's the game. They keep pushing back on shit that Trump never said, and specifically said, no, I'm not about that. So you think that Trump is going to do this? That's the game.
You. In an interview in 2023 and again in 2024, you blamed school shootings on antidepressants. You said, and this is a quote, "There is no time in American history or human history that kids were going to shoot schools and shooting their classmates. It really started happening coterminous with the introduction of these drugs, with Prozac and with other drugs." So do you believe, as you've said, that antidepressants cause school shootings?
Yes.
This should be a simple question.
Oh, it is. It is. Oh, it is so simple. When I got off using drugs, when I got off abusing drugs, and I realized that, oh, wait, there's a reason that I was, looking to find my way over into doing drugs. Maybe some things up here weren't working in the way that I wanted them to work. Then I went to a doctor. And they're like, oh, we should put you on these SSRIs. And I was like, no. I'm taking a shit ton of Xanax and it fucking works. So if I just don't abuse it, I'll be good. Never would I put myself on one of those things.
Believe, as you've said, that antidepressants cause school shootings. This should be a simple question.
I don't think anybody can answer that question, and I didn't answer that question. I said it
So
should
your
be
answer
studied.
is,
I said it should be studied along with other potential culprits
so
like
they may cause
social media. But I don't know. I would never make, because there's no science on that.
Well,
Senator.
there is, Senator. I mean, excuse me. There is, Mr. Kennedy.
Thank you for the promotion.
I mean, benzos are as well, which is something to be taken into account when somebody's going to choose between SSRIs and benzodiazepines.
The science shows.
The science! The science! The science! dilly dilly to the science.
That there is no link between school shootings and antidepressants. And
Oh, well, there we go. There we go. There we go. Columbine was in the 90s, but yeah, we all have this long-term study done already.
in fact, most school shooters were not even treated with antidepressants. And of those that were, there was no.
Wait, what? What did I miss? Thank you for the promotion.
Senator, I mean, excuse me, there is, Mr. Kennedy.
Thank you for the promotion.
The science.
I missed that. Okay, wait.
Yeah, but I don't know. I would never make, because there's no science on that.
Well,
Senator.
there is, Senator. I mean, excuse me, there is, Mr. Kennedy.
Thank you for the promotion.
The science shows that there is no link between school shootings and antidepressants. And in fact, most school shooters were not even treated with antidepressants. And of those that were, there was no evidence of association. You know,
I don't think you
my
can
question
say that, Senator.
Which, and yeah, so everyone's like, you're right. All these drugs are dangerous. And so when we are in a society where this is manifesting a lot, whether it's a genetic thing, whether it's because of the food, whether it's microplastics, it simply was not a thing. It simply was not a thing. On a lower scale, you could talk about peanut allergies. That, I mean, okay, that was kind of a thing when I was a kid. Like you could still bring peanut butter to school. Like I know my sister's age at some point, they're like, you can't even bring peanut butter or whatever. It's just so obvious. It's like, what do you think the argument here is? Shout out to the mighty Sarlacc. Welcome to the parties, to the propaganda. I mean, the science says, come on, man. Welcome. I must have known, said when self-deletion is listed as a side effect, yeah, we need to look into that. Agree. Right-click's having fun. I want to post that she's arguing a point he didn't make. Exhausting to listen to. It's almost like it's bullshit. There's tons of science from the pharmaceutical companies that say everything's good and fine and nothing's harmful. We should trust them. Because it's the science. Okay? It's the science. You don't distrust the science, you goddamn conspiracy theorist. Sam said, I took myself off antidepressants. I ended up crazy for 4 months. Still not right after 2 years. And I mean, there's definitely something to be said about, okay, maybe there is something that could benefit your life that is, I'm not going to sit here and say that these medications are completely useless. That's not the point here. It's just not it shouldn't be a default. Like, I definitely need shit for my shit. Like, that's cool. Like I'm glad we have medical science, but everything goes too fucking far. And yeah, right. Shout out to was it Matthew Broderick? Who was in Painkillers? Yeah, great movie. And as somebody who was addicted to Oxy, it felt good to see this fucking asshole. Since this began when companies were given permission to advertise. Yeah, I mean, I hear you, man. And it definitely is a dark road, but like it would be wrong to say that these medications don't help people. That's not the point here. And you might be a person who is helped by these things. The problem is the degree to which they say, like, take it completely out of any of this stuff. Let's talk about chemotherapy. Chemotherapy works if you have cancer sometimes, right? So there might be a situation where chemotherapy is the right option for you. But if you go to the doctor because you have a headache or because you've been feeling blue and they say, okay, you need chemotherapy, then that's a sign that the medical system is not doing what it's supposed to do.
Because the HIPAA rules, nobody knows.
Well, that is, Mr. Kennedy, do you
For a little while. Oh, yeah, for a little while. It definitely will.
think that people who take antidepressants are dangerous?
They could be. Depends on who they are.
I think, listen, I'm not going into HHS if I'm privileged to be confirmed with any.
So you can't say that people
to
who-
impose any preconceived ideas that I may have. I just want to have
Okay,
good science.
So you're not saying that they aren't dangerous, which means that they could be
That's right.
dangerous. Let me ask you this.
That's
You
not
just-
true.
They absolutely could be dangerous. Is he sitting here saying it's not true that they could be dangerous?
Saying that they aren't dangerous, which means that they could
That's
be
right.
dangerous. Let me ask you this.
That's not true.
You've described Americans who take mental health medications as addicts who need to be sent to wellness farms to recover. Is that what you believe?
No, of course, I didn't say that
Yes, you
anybody should be compelled to do anything.
No, but
I'm
you
for-
said they should be sent.
I said they should be available.
Should be if what circumstances, if they want to treat that, and if they. It's so easy if you're not fucking retarded. It's so easy if you're not fucking retarded. If you're retarded, then you probably think that Bobby's a bad guy. If you're retarded, you probably think he'll kill millions of children and won't even bother him of the lives lost. But if you have two brain cells to run together, you can see how deep the bullshit runs.
To them,
You
I
said
didn't
that-
say they should be sent.
You said that folks
Kicking and
that take
screaming.
antidepressants are like addicts. That I can provide that.
Oh,
Mr. Chair.
Okay, so ask him if heroin addicts should be sent this way, that way, or the other way. Guess what he's going to say? No. That doesn't mean he doesn't want to help them.
Stupid.
These false dichotomies.
They should have the availability. Listen, I know people, including members of my family, who've had a much worse time getting off of SSRIs than they did than people have getting off of heroin. It's the withdrawal period is.
And he would know, right? Right, Boyd? Right, Boyd?
I mean, and it's written
actually have
on the
s-
label.
I have some
This is
experience
very
with
well
this
documented.
myself, Mr. Kennedy. This is personal for me. When I was
Oh, why does that not fucking surprise me?
a young woman and I was struggling with depression, thankfully, I had the resources to help me get through it, including a new generation of SSRI uptake inhibitors, which helped to clear my mind, get me back on track to being a mom and a wife and a productive, happy person. And I'm really grateful for that therapy. So I have some experience with this, and I think that everyone should have access to that care. And your job as secretary is to expand access to care, not to spread lies and misinformation. And, the things that you say, Mr. Kennedy, they live on. They have impact. And, we're having this conversation at the same moment that my Republican colleagues are looking to try to figure out how to save money any way they can. And so they want to cut
How dare save money? Save money?
How dare you?
Awful people.
Medicaid. Let's just think about this for a minute, because you're going to be, should you be confirmed, you would be responsible for CMS, which provides mental and behavioral health care to millions of Americans. Close to 40% of folks on Medicaid have a behavioral health condition. And you would be part of this administration that would be looking to cut Medicaid. So, Mr. Kennedy, these statements that you've made linking antidepressants to school
Hook me up.
shootings, they reinforce the stigma that people who experience mental health every day face every single day. And I'm very concerned.
So they get their feelings hurt. So the truth shouldn't be spoken because their feelings get hurt. Shut up.
This is another example of your record of sharing false and misleading information that actually really hurts people.
Is it though? Sounds like something you just don't like and also is true.
Senator, you're
Thank you, Mr.
mischaracterizing my statements.
I am only putting into the record what you have said, Mr.
You're
Kennedy.
Yeah, and by mischaracterizing.
mischaracterizing my statements, and I'm happy that you had a good experience on SSRIs. Many Americans have very good experience on it. Others have
That would
not.
be an issue between them and their physicians, and not for
And
the future
exactly.
head of HHS to be just putting out misinformation.
Right, that's his fucking point. That's his position. All right, I can't. Let's hit the lightning round where fucking old man liberal was like, I need more time. It was right after this dude, 320, right? 320. They go for the lightning round. What is all this? What is he saying here? Let's see what he's got.
Community health centers that Senator Warner was talking about are up in the air as to what they can do. Do you believe that a president?
Me? This is my fucking living room, bro. I got my living room, my kitchen, and my bedroom is a loft upstairs. No, I don't have soundproof. Shit. Shout out to the neighbor. Sorry if I'm loud.
can impound money that has been appropriated by Congress?
Senator, let me answer the question about Medicare first. I have never defended that program or the rapacious behavior by insurance companies or the PBMs. I understand that's a huge problem.
Rapacious, that's the root word is rape, right?
Rapacious behavior by insurance. I've never defended that program or the rapacious behavior.
That's what that means, right?
By insurance companies or the PBMs. I understand that's a huge problem. And
all right, I don't have time. We've got to get over to vote. So we can do this.
But you've asked me 5 questions. You got to give me a chance to answer one of them.
Please be brief.
Yeah, I have a point I brought in.
I wonder if maybe that woman went from antidepressants to antipsychotics and just happened not to refill her meds the last few days, trying to give her the benefit of the doubt. Fair enough. I mean, I will tell you, there's been plenty of times where I've needed my my benzos, and I go in and they say, you got to wait an extra day, and it's not a fun day. So maybe that's her. Yeah, right. Rapacious. And I feel like that slides right over the algorithm. This rapacious motherfucker.
If I get confirmed, I've already appointed a general counsel. The first time in history, he's a former prosecutor who prosecuted the biggest Medicare fraud in the case in the state of West Virginia. I brought in a prosecutor for that job instead of a bureaucrat, precisely to address the important issues that you raised here. The only reason I didn't talk about these before is because I wasn't asked about them.
What about?
I agree with you 100%.
What about impounding the president impounding money that, among other things, goes?
Are we thinking the same thing? I think we're thinking the same thing.
To healthcare.
And you're saying that that's illegal?
That's correct.
Whoa. What's illegal?
I agree with you 100%. I didn't talk about these before is because I wasn't asked about them.
What about?
I agree with you 100%.
What about impounding the president impounding money that, among other things, goes to healthcare?
And you're saying that that's illegal?
That's correct.
Well, my job is to uphold the Constitution. I'm going to take an oath to uphold the Constitution, and I will administer the law and uphold the Constitution.
So who broke the law? What the fuck are we talking about?
Thank you.
So you just... What was that all for? You got someone to admit that somebody did something illegal. I was like, oh, that's all I got. That's all I got. All right, dude. I mean, good job. Whoever voted for you, good job. All right, we got the lightning round. This entire side needs another go. So let's see. I have not watched the lightning
Mr. Chairman,
round.
I believe under what we've discussed, I control 5 minutes. I'm going to take one and give one to each of my 4 colleagues that remain.
All right, and I would just say this vote, they're going to call it in about 8 minutes.
Thank you.
So we have very little time.
Two hours ago, colleagues, I asked Mr. Kennedy to reconcile his many anti-vaccine statements with his handful of pro-vaccine statements. Instead, he gave us a word salad and ducked the issue.
Did he now?
The same was true, Mr. Kennedy, with respect to measles, where you wrote a book playing down the threat of measles, even though American families are very concerned about it.
Still haven't asked him about context for that, just making assertions.
And apparently families are still mourning in Samoa. And my last point would be that Mr. Kennedy said today really wasn't about him. And I just
agreed.
Want to tell him it is all about you.
Doesn't seem like it.
Because
seems like it's all about you.
I find your presentation to be both
and we can tell that you dye your hair.
To be both untrustworthy and unprepared.
Oh no, the government doesn't trust. Oh, well then, I mean, that's the end of it. That's the end of it.
Because my colleagues have been seeing back and forth between Medicare and Medicaid, and it's not clear.
Hey, yeah. Shout out to Indie Film with the $20. My goodness. Let's give Morty a double here. So does anybody ask how now that chemicals seem to solve problems for people that had problems for 1,000 years and they never needed them, this chick is a crazy person. Nope. She's listen. She's a senator. Okay? And so that means that she can't say anything that's not true. She's in the government, bro. Come on. You know this. Thank you so very much. I'm sponsoring yourself. Very, very, very much appreciated, sir. Let's keep this raging.
Which program you're using when. So I want colleagues to know there is a lot more information to learn about Mr. Kennedy before we vote. I'm going to urge that to my colleagues on both sides of the aisle to not make decisions on the basis of this session. I thank you for the additional time. And
Wait. He didn't just say what I thought he said, right? He didn't just say that all of this was bullshit because he didn't say anything and we shouldn't make our decision based on. Is that what he said?
Before we vote, I'm going to urge that to my colleagues on both sides of the aisle to not make decisions on the basis of this session. I thank you for the additional time.
Yeah, Bobby just came in for 3 hours, but just go on your just go on your gut.
What?
He just said that publicly. Like, obviously, you're gonna think that. Oh, it'd be great if nobody paid attention. I get that. Fine. I get even be like, yo, let's try it. Is there any way we can get around this? And like, I get that too. You're a politician. You're a piece of shit. I get it. But to publicly say, look, guys, this didn't go the way that we wanted to go, so let's just ignore it. That is insane. That is insane. That was a thing that was just spoken aloud publicly in a Senate hearing. This is your government. This is your government. One of us said, who's concerned about measles? Is there some big group of Americans out there who have been getting measles? Well, I mean, actually, I think there was an outbreak like a few years ago, but point taken. So we all know how they will vote. Well, again, I believe it was yesterday. RFK was advanced. So I think there's another step before he's confirmed. But it said advanced. That word kept coming up. So, yep, exactly what you're trying. Plug your ears, close your eyes, and vote your gut. That's the American way.
Make decisions on the basis of this session. I thank you for the additional time. And I guess my next minute is Senator Whitehouse, Senator Warren, and Senator Smith.
And again, 1 minute each, please.
There's been a lot of conversation about late-term.
Oh, this fucking guy. Oh, you're gonna ask a question this time? Put one in the chat if you think he's not going to ask a question.
1 minute each, please.
There's been a lot of conversation about late-term abortions here, and I just want to make clear what Rhode Island OBGYN doctors describe as what is
I see no one, so everybody thinks he's going to ask a question, right?
almost always happening when a late-term abortion is needed. It is a childbirth gone wrong.
Mm-hmm.
The family has painted the room. It has bought the crib, maybe even decided on the baby's name, and has gone to the hospital to welcome the new baby into their family in what is supposed to be a happy event. And then things went wrong. Then the alarms started pinging. The lights started flashing. The medical professionals started rushing in. And the question became, who lives and who dies? The mom's life is often at risk, and she may have other children she needs to care for. The baby's life may be at
Oh, now it's a baby. Now it's a baby. I thought it was just a fetus. I thought it was just a clump of cells. Now it's a baby.
she needs to care for. The baby's life may be at risk, and one or both may die. In that environment,
Okay, so if they don't, so if that's the situation, then we kill the baby. Okay? If it's one or the other, we kill the baby. I'm okay with that. If it's one or the other, we kill the baby. What if it's not, Mr. White House?
and one or both may
Yeah, still no question yet.
die. In that environment, the doctors and the family own that decision. Government has no place in that room at that point.
But you're the one who wants to put the government in there and say what does or does not have to happen.
And I think we need to understand when this late-term abortion gets bandied about, what you're dealing with is a tragedy that is happening to a family who wanted that child and have suddenly been confronted with a moment in which they have to make what is probably going to be the worst decision of their lives. And to try to shove the state legislature into that room is really offensive, really morally wrong. And I just want to make very clear what Rhode Island OBGYNs tell.
He's getting close to that 1 minute.
Is the
Any
situation
question?
when these procedures have to be deployed.
Yeah, all right. And fucking shout out to and I want to vote here in states. Now, thanks to our amazing president, abortion laws are outside of the scope of what the HHS even has to do with. Well said. Kelly Green said just call it something dehumanizing, then kill it. Pocket lint, throw it away. That's pretty, I mean, you're not far off.
Senator Warren.
Oh, baby, Pocahontas. Pocahontas is coming back. Let's take a drink. Didn't go her way last time, so she knows she's got to come through.
Thank you, Mr. Chairman. So, Mr. Kennedy, I wanted to ask about your role in the 2019 measles outbreak in Samoa.
So that's what, okay. I was talking about that. Who was asking about it? Yeah. So there, in 2019, there was an outbreak, but ironically, it was a lot of left-wing people, as we were discussing before, who were anti-vax in California, and she's talking about Samoa, conveniently, but this was in the U.S. as well.
About your role in the 2019 measles outbreak in Samoa. In July 2018, 2 children died immediately after receiving a measles vaccine that nurses had mistakenly mixed with a muscle relaxant. The nurses get charged with manslaughter, but vaccination rates go down. I asked you about this in my office. You told me flatly that your visit to Samoa had nothing to do with vaccinations. We now know that's not true. I have the documentation. You met with the prime minister. You talked about vaccinations. You met with an anti-vaccine influencer who described the meeting as, quote, profoundly monumental for this movement. So what happens? Vaccinations go down. There's a measles outbreak and children start dying. But you...
Pocahontas! Pocahontas! Oh my God.
Double down. You didn't give up. Just 4 days after the prime minister declared a state of emergency, 16 people already dead. You sent a letter to him promoting the idea that the children had died not from measles, but from, quote, defective vaccine. You launched the idea that a measles vaccine caused these deaths. You are a very...
Okay, but did it? You have to include that. Pocahontas, there you go. Pocahontas, nice. Very, very nice.
Yeah, that a measles vaccine caused these deaths. You are a very influential man. In fact, you are called the leader of the disinformation dozen. UNICEF and WHO, the World Health Organization, investigated this. They say the claims are false. It is not biologically.
Oh, well, if they said it's false, I mean, it must be false, right? Because they've never lied before.
Possible what you claimed. And yet, ultimately, more than 70 people died because they didn't get vaccines. So my question is, do you accept even a scintilla, just even a sliver of responsibility for the drop in vaccinations and the subsequent deaths of more than 70 people?
Well,
Anything?
The drops of vaccinations, maybe, but the deaths, no. See, adults have this thing called agency. Some of you believe that we even have free will, yet it's his fault that other people did things. Okay, that'll make a lot of sense. Yeah, why should he be? He shouldn't. You know what I'm saying? Wait, is she saying children who were, I don't know, a week old received the vaccine and died? And she said it's not because of the vaccine? No way. They were exposed to measles in that time. Correlation does not equal causation. Unless you're a lib on the panel here. Then, of course, it does. It does. Well, she's going to try to make it that.
Vaccinations and the subsequent deaths of more than 70 people. Anything you do differently?
No, absolutely not. After there were 2 incidents which children died in 2015 and again in 2015, it was from the measles vaccine. That's what the New Zealand General Hospital found. The government of Samoa banned the measles vaccine after the 2018. I arrived in July of the next year after the ban had been in place.
Who's talking? Can you shut the fuck up? Can you shut the fuck up while we're trying to listen to this man? Jesus Christ.
In July of the next year, after the ban.
This guy's never going anywhere. Fuck this asshole. I don't even, this guy, come on.
And had been in place for a year.
Mr.
And the
Chairman,
measles.
understanding that you wanted to hold us
mid-sentence
to a minute, and that I don't get to present all the facts and documentation I've got. How about if we just decide to make entries for the record on exactly what the record shows about Mr. Kennedy's participation? And I think he's answered the yes or no question. He takes no responsibility.
Senator Warren, we will do that.
Correct.
And Mr. Kennedy, and to all the senators, every senator knows that following this hearing, they will be able to ask you questions off the record, and you will be able to put answers back onto the record. So please give that answer. I apologize that we're shutting you off for giving a full response right now.
Yeah, because if you keep talking, then we are going to be fucked. I know I'm on your side, but, I got to keep up appearances and pretend like I'm not going to be fair to the people and only fair to the establishment. That is my job. So those are the highlights. Those are the highlights of the, there's plenty more. There's plenty more. I put the link to the entire 3.5-hour thing in the description. Now, of course, we just spent 4.5 hours here because you guys were so amazing to me. But 3.5 hours just watching this dry bullshit is not the same as 4.5 hours partying with us. So unfortunately, no Swoggle. I ain't got to do shit because you guys were too late. But Morty is very much appreciating his peanut butter. Thank you so much. Let's see what Unwanted Post says before we head to the after party. And guys, I did just drop the link to join as a member if you're on a PC. It's right below the video. I don't even know where it is on a phone, but find it. It's not that hard. And the link is right there, both for the membership and the free Discord. So if you are not a member, hit the pinned link. You can join for free. I just saw Sam. Sam just joined for free. He's not a member. If you are a member, you can still join for free. But because you're a member of this channel, you get all the extras, including the after party. What do I want to both say? Bet she doesn't try holding the same accountability to Fauci, who was far more directly involved with these deaths. That is the name of the game. That is the name of the game. You're absolutely right. And it's sad that people don't see it yet. People don't see it yet, guys. So that is what I'm here for. I'm not trying to be the most high-minded, bring you the most breaking news of whatever. I honestly hope that RFK would be on some podcast or something that we could discuss, and he would be talking about this. That's a little bit more what I'm interested in, but nobody was doing it. So I know that you motherfuckers didn't sit through and watch that whole thing. So I knew that I had to do it, and I'm glad I did. It seems like you guys did enjoy this. I already went through the Tulsi Gabbard one. If you want to do that, let me know. Yeah, I think it's important to be able to see how the landscape is changing and why each little piece gets into place. So this is what we do, guys. If you are new here, again, hit that subscribe. It's free to subscribe. There's a whole bunch of free shit you can do on YouTube. It's crazy. You just hit buttons and it's free. The like button's free. Hit the subscribe button's free. Hit that share button. Definitely free. And of course, it doesn't even matter if you think people are going to click on the link that you shared just by you telling YouTube that, hey, I like this. I want more people to see it. They will show it to more people. And the parties will get bigger and bigger and bigger and crazier. Let's keep it rolling. And of course, if you are a member, heading on over to the after party. Thank you, thank you, thank you so very, very much to all of the donations coming through all night. Thank you, thank you, thank you, thank you so very, very much, each and every one of you. You guys are amazing. And of course, our sponsor of the stream, IndieFilm. Thank you again, guys. Live every Monday, Wednesday, Friday, 8 p.m. Eastern. And sometimes whenever I feel like it, so hit that subscribe or ring the bell, and you will never miss an Indian Jesus live party ever again. Join to hit the after party where we are headed right now. Until then, once again, this is Morty, and I have been your host, Lutch, aka the Indian Jesus, here to resurrect the second coming of common sense. Until next time, guys, we are out of here. Peace.